level. Every piston is firing. Everything that can be done is being done. New Yorkers are lucky. We have a very experienced team that's doing this. This is not their first rodeo. They've been through a number of emergencies on a number of levels, increasing hospital capacity. We want to get the capacity of 50,000 up to a minimum of 75,000. We told the hospitals we're going to be ending elective surgeries. We are now working with hospitals to reconfigure the space in the hospital to get more beds and to find more staff to manage those beds. We're working on building new beds. We're going to go out and review a number of sites today. I'd like to get a final list to the federal government and the Army Corps of Engineers today. But we're looking at Javits, SUNY Stony Brook, SUNY Westbury, the Westchester Convention Center, and I'm going to go out and take a look at those sites today, or the ones I can get to. That would give us a regional distribution and a real capacity if we can get them up quickly enough. And then increasing supplies, which is one of the most critical activities. We are literally scouring the globe looking for medical supplies. We've identified 2 million N95 masks, which are the high protection masks. We have apparel companies that are converting to mask manufacturing companies in the state of New York in all sorts of creative configurations, and I want to thank them. I put out a plea yesterday to ask them for help, and we've been on the phone with all sorts of companies who are really doing great work. We're also exploring the state of New York manufacturing masks ourselves. We are going to send 1 million N95 masks to New York City today. That's been a priority for New York City. And 1 million masks won't get us through the crisis, but it'll make a significant contributions to New York City's mask issue. And I want to thank Mayor de Blasio for working in partnership. We're sending 500,000 N95 masks to Long Island. We've been working with County Executive Laura Curran and County Executive Steve Ballone, and I want to thank them. We're gathering ventilators. Ventilators are the most important piece of equipment and the piece of equipment that is most scarce. We're gathering them from all different health facilities across the state. And then we're going to use those in the most critical areas. We also identified 6,000 new ventilators that we can actually purchase, so that's a big deal. From the federal government's point of view, I've spoken to the President a number of times. I've spoken to the Vice President a number of times. They've issued a federal disaster declaration, which is a technical act by the federal government. But what it basically does is it allows the Federal Emergency Management Agency, called FEMA, to step in and assist financially. By that declaration, FEMA would pay 75% of the cost of a disaster. New York City would pay 25%. New York State would pay 25% of the cost. The federal government can waive the 25% of the cost. I'm asking them to waive that 25% in this situation. I've worked on many disasters. FEMA has waived the 25%. If there's any situation where FEMA should waive the 25%, this is the situation. We're also working with the federal government. We're requesting 4 field hospitals at 250 capacity each. That would give us 1,000 field hospital beds. We're going to be looking at Javits as a location for those field hospitals. We're also requesting 4 Army Corps of Engineers temporary hospitals. Those are the sites I mentioned earlier that I'm going to take a look at. The SUNY Stony Brook, Westbury, Westchester Convention Center, and also Javits. Javits is so big that it can take the 4 field hospitals and an Army Corps of Engineers temporary hospital. We're also requesting assistance with medical supplies. which has been a very big topic of conversation all across the country. And we're also asking our federal congressional delegation to fix a law that was passed on the coronavirus federal aid. Because of a technical issue, the way the bill was written, New York State does not qualify for aid. That's over $6 billion. That is a lot of money. And we need the federal delegation to fix that bill. Otherwise, New York State gets nothing. New York State has more coronavirus cases than any state in the United States of America. That we should not be included in the bill obviously makes no sense. We're also going to conduct immediately trials for the new drug therapy, which we have been discussing. I spoke to Dr. Zucker about it. There is a theory that the drug treatment could be helpful. We have people who are in serious condition, and Dr. Zucker feels comfortable, and as well as a number of other health professionals, that in a situation where a person is in dire circumstance, try what you can. The FDA is going to accelerate to New York 10,000 doses. As soon as we get those doses, we'll work with hospitals, doctors, and families on using those drugs and seeing where we get. The president he spoke to this drug therapy in his press conference yesterday. I spoke to him afterwards. I said that New York would be interested. Again, we have the most number of cases, and health professionals have all recommended to me that we try it, so we will try it. We're also working on a number of other drug therapies, an antibody therapy, possible vaccines. We have a company here in New York called Regeneron that is really showing some promising results. I've exempted them from the no work order because they could possibly have a really significant achievement for us. The new numbers, the more tests you take, the more positives you find. And I give this caution because I think people misinterpret the number of new cases. They take that number of new cases as if it is reflective of the number of new cases, the spread. It is not. The number of new cases is only reflective of the number of cases you are taking, right? Where our goal is to find the positive cases, because if we find a positive case, we can isolate that person, and that stops the spread. So we're actually looking for positives. The more tests you take, the more positives you will find. We are taking more tests in New York than any place else. We're taking more tests per capita than China or South Korea. We're also taking more tests than any state in the United States of America. That is actually a great accomplishment. Because if you remember back 2 weeks, which seems like a lifetime now, the whole question was coming up to scale on tests. How do we get the number of tests up, and how do we get it up quickly? I spoke to the president and the vice president, and I said, decentralize the testing and let the states do it. I have 200 labs. I can mobilize quickly. Let us do the tests. They agreed. We're doing more tests than any state. So, for example, we've done 45,000 tests. California has done 23,000. Washington has done 23,000. So you see how many more tests we are doing. And again, I credit the team that's working here because this is exactly what the mandate was. Perform as many tests as quickly as you can. And that's the drive-throughs we put in place, the hospital management, et cetera. So our numbers should be higher, and they are. Total number of positive cases now is up to 10,000. Number of new cases has increased by 3,000. Just go back in case you can't read as fast as I can't read. 6,000 in New York City, 1,300 in Westchester, 1,200 in Nassau. You see the Westchester number is slowing. We did a New Rochelle containment area. The numbers would suggest that that has been helpful, so I feel good about that. You see Nassau increasing, you see Suffolk increasing. So that's just the widespread increase that we have been anticipating. But our hotspot of Westchester is now slowing, and that's very good news. New York City, it is the most dense environment. This virus spreads in density, right? That's what you're seeing in New York City. New York City obviously has many more people than any other specific location in the state. Number of counties are increasing. You see the blue. I said to you early on that blue is going to take over the whole state, just the way every state in the United States has now been covered. Most impacted states, you look at the number in cases in New York is 10,000, Washington, California, 1,000 each. Does that mean we have 10 times the number of cases as California or Westchester? Or does that mean we're doing more tests than California or Westchester? The truth is somewhere in the middle, and nobody can tell you. Total number of people tested, we're up to 45,000. Number of new tests. This is a rate that we watch. What is the rate of hospitalization? Again, because this is all about hospital capacity, right? 1,600 out of 10,000, that's roughly 15% of the cases. It's been running about 14, 15. It's gone as high as 20%, 21%. So actually 15% rate of hospitalization is not a bad number. It's actually down from where it was. The more refined number is of those who are hospitalized, how many require the ventilators, because the ventilators are the piece of equipment that is most scarce. That's the next refinement of these numbers that we have to do. And again, the context on the numbers is important. We're talking 10,000, et cetera. You look at any World Health Organization or the NIH or whatever any of the other countries are saying, you have to expect that at the end of the day, 40% to 80% of the population is going to be infected. So the only question is, how fast is the rate to that 40% to 80%, and can you slow that rate so your hospital system can deal with it? That is all we're talking about here. If you look at the 40 to 80%, that means between 7.8 million and 15 million New Yorkers will be affected at the end of the day. We're just trying to postpone the end of the day so we can deal with the capacity. Again, perspective, Johns Hopkins. This is not a science fiction movie. You don't have to wait to the end of the movie to find out what happens. Johns Hopkins has studied every case since it started, 284,000, 11,000 deaths, almost 90,000 recoveries, 183,000 still pending, which tracks everything we know in the state of New York. Our first case, healthcare worker, 39-year-old female who was in Iran. She went home. She never went to a hospital. She recovered. She's now negative. You get sick, you get symptoms, you recover. That is true for the overwhelming number of people. Again, context. People who died in the flu, from the flu, in 2018, 2019, 34,000 Americans. 34,000. So when you hear these numbers of deaths, keep it in perspective. 34,000 people died of the flu. Over 65, 74% of the people were over 65. 25% we're under 65. So if you have an underlying illness, you catch the flu, you can die. More likely, if you have an underlying illness, senior citizens, et cetera, but not necessarily. You have 25% under 65 years old die from the flu. Also, in terms of context perspective, don't listen to rumors. I mean, you have such wild rumors out there, and people call me with the craziest theories. I understand there's anxiety and stress, but let's remember some basic context and facts. Society functions. Everything works. There's going to be food in the grocery stores. There's no reason to buy 100 rolls of toilet paper. There really isn't. And by the way, where do you even put 100 rolls of toilet paper? The transportation system functions. The pharmacy system functions. These things are all going to work. Non-essential workers stay home, but the essential workers are staying home, especially the healthcare workers. There is not going to be any roadblock when you wake up in the morning that says you can't leave this place or you can't leave that place, right? So if you have a real question, because you think there's a real concern from a credible source, contact my team. We have a special website, coronavirus.health.ny.gov, and ask the question, and you will get a real, truthful, factual response. I have not hidden anything from the people of this state. I have not tilted facts. Franklin Delano Roosevelt, the American people deserve the truth. They can handle the truth. Give them the truth. When they don't get the truth, and if you don't get the facts, that's when people should get anxious. If I think I'm being deceived, or there's something you're not telling me, or you're shading the truth, now I'm anxious. Everything I know, I've told you, and I will continue to tell you. And these are facts. And you hear a rumor, and you want to check it out, go to that website. These are people who work for me directly, and you will have the truth. We do have an issue with younger people who are not complying. And I mentioned this before, but it has not gotten better. You know, you can have your own opinion. You cannot have your own facts, okay? You want to have an opinion? Have an opinion. But you can't have your own facts. Well, young people don't get this disease. You are wrong. That is not a fact. 18 to 49 years old are 54% of the cases in New York State. 54%. 18 to 49 years old. So you're not Superman, and you're not Superwoman. You can get this virus, and you can transfer the virus, and you can wind up hurting someone who you love, or hurting someone wholly inadvertently. Social distancing works, and you need social distancing everywhere. There's a significant amount of noncompliance, especially in New York City, especially in the parks. I'm going to go down there today. I want to see what the situation is myself. But it has to be stopped, because you are endangering people. And if it's because of misinformation, if it's because of noncompliance, I don't care, frankly. This is a public health issue, and you cannot endanger other people's health. You shouldn't be endangering your own, but you certainly have no right to endanger someone else's. This is my personal opinion. This is not a fact. You know, to me it's very important that, especially in a situation like this, tell me the facts and then tell me your opinion. This is my opinion. We talk about social responsibility, especially young people talk about social responsibility, and they should. We pass a lot of legislation in this building, groundbreaking legislation, national firsts on economic rights, first highest minimum wage in the United States of America, human rights, first state to pass marriage equality, which I believe was a human rights issue. We talk about environmental responsibility. This state has the most aggressive environmental laws in the United States of America, and I am proud of it. But I also want people to think about the social responsibility when it comes to public health. We haven't talked about it before. It's not really a field. It's not really an issue. It's not really a hashtag. But social responsibility applies to public health just as it applies to human rights and economic rights and environmental rights. Public health, especially in a moment like this, is probably most critical. So let's think about that, and let's act on that. In this crisis, think of ourselves, we are all first responders. We are all first responders. Your actions can either save or endanger a life. So we are all first responders. What's going to happen? We're going to get through this. We don't know how long it is going to take us to get through this. Fact is, we're trying to slow the spread of the virus to a number of months so the healthcare system can deal with it. So therefore, by definition, it's going to be a number of months. I know people want to hear it's only going to be a matter of weeks and then everything's going to be fine. I don't believe it's going to be a matter of weeks. I believe it is going to be a matter of months. But we are going to get through it. And how long and how well it takes us to get through it is up to us. It depends on what we do. You know, when you're sick and you say to the doctor, well, how long until I get better? And the doctor says, well, it depends on what you do. If you follow the advice, you'll get healthy faster. But it depends on what you do. This depends on what we do. China is now reporting no new cases. Let's assume that's true. Look at that trajectory and look at that turnaround. Look at what they did, right? We do have data that we can follow. So how long is it going to take? It depends on how smart we are and how responsible we are and how diligent we are. You tell me the percentage of compliance and intelligence and discipline on social distancing, et cetera, I'll tell you how long it takes us to get through it. Also, something that people aren't really talking about, but I think we should start talking about, we talk about the economic consequences of this situation, and they are going to be significant, and we are going to have to deal with it, and New York will be right on top of it and as aggressive as we are with everything else. But economic consequences come second, right? First is dealing with this crisis. And we talk about the economic consequences, but we also need to talk about the social consequences. And it's hard to gauge and it's hard to measure because there is no Dow Jones index that we can watch on the screen that is measuring the social consequences and the social decline. But the stress, the anxiety, the emotions that are provoked by this crisis are truly significant. And people are struggling with the emotions as much as they are struggling with the economics. And this state wants to start to address that. I'm asking psychiatrists, psychologists, therapists who are willing to volunteer their time to contact the state. And if this works out, I would like to set up a voluntary network where people can go for mental health assistance, where they can contact a professional to talk through how they're feeling about this. They're nervous, they're anxious, they're isolated, can bring all sorts of emotions and feelings to the surface. When you're isolated, you don't have people to talk to. So I'm asking the professional mental health establishment to contact us, let us know if you're willing to volunteer time. It would obviously be all electronic. It wouldn't be in person. It would be over the telephone. It would be Skype, etc. But I'd ask you to seriously consider this. Many people are doing extraordinary things during this public health crisis. I'd ask the mental health community, many of them are looking for a way to participate. This is a way to participate. And if we get enough mental health professionals willing to volunteer their time, then we'll set up a mental health electronic help center. And we'll talk more about that in the next few days. What happens, besides how long, what happens? The bigger question to me is, what do we learn about ourselves through this? As a society, we have never gone through this. Thank God, we haven't gone through a world war. We haven't gone through any great social crisis here in New York. We went through 9/11, which I think is relevant in terms of some feelings that are now people are experiencing. 9/11 transformed society. I was there, I was part of it. You were never the same after 9/11. You had a sense of vulnerability that you never had before, which I feel to this day. There was a trauma to 9/11, but as a society, as a country, we've been blessed in that we haven't gone through something as disruptive as this. So what do we learn about ourselves? And I think what we're seeing already is a crisis really brings out the truth about ourselves, first of all, and about others. And you see people's strength and you see people's weaknesses. You see society's strengths and you see society's weaknesses. You see both the beauty and the vulnerability. You see the best in people and you see the worst in people. You see people rise to the occasion, and you see people fall from the burden of the emotion. So I think you take a step back. First, there are people who are doing extraordinary work, who deserve our thanks. And when you see a healthcare worker on the way to work, when you see a grocer who's been working a double shift, trying to deal with the demand in these stores, when you see a pharmacist who's overwhelmed with the long lines, when you see a police officer, firefighter, who they're out there doing their job, they're opening doors, they don't know who's on the other side of the door, they're walking up to car windows. These are just extraordinary heroes. Heroes. Ask yourself, would you do that? I mean, what kind of selflessness and courage? You talk about public service. What does public service mean? This is public service. This is public service in stereo and on steroids. These are people really stepping up. When you see them, say thank you. The bus drivers, the subway drivers, the public transit workers. These are people who are showing up. They're leaving their family. They are just as nervous as you are, but they're doing their job. Child care workers who are watching people's children so they can go work in a hospital or do their essential function. They deserve our thanks. And I think understanding what they do in some ways gives us a perspective on how beautiful people can be and how courageous people can be and how great Americans can be. And my last point is practice humanity. We don't talk about practicing humanity, but now, if ever there's a time to practice humanity, the time is now. The time is now to show some kindness, show some compassion to people, show some gentility, even as a New Yorker. Yeah, we can be tough. Yes, this is a dense environment. It can be a difficult environment. It can also be the most supportive, courageous community that you have ever seen. And this is a time for a little gentility. It's a time for a smile when you're walking past someone. It's a time for a nod. It's a time to say hello. It's a time for patience. And don't let the little things get you annoyed. That's New York at its best. That was New York after 9/11. Yeah, we have a problem. Yes, we will deal with it. Yes, we will overcome it. But let's find our better selves in doing it. And let New York lead the way in finding their better selves and demonstrating their better selves. That's the New York destiny, and that's the New York legacy. And that's why I'm proud to be a New Yorker. That's why I'm proud to be the governor of this great state. And we're going to do it like we've always done it before. Questions?
Governor, on the 6,000 ventilators, where were those located and how soon could they be in hospitals in New York?
They were located in places all across the globe, Jesse. They will be coming in over the next several weeks. We're also looking, by the way, at technologies that would allow you to use one ventilator for multiple patients, where one ventilator, for example, could serve 2 patients. So we're getting as creative and as aggressive as we can.
And can we assume that most of those would end up in New York City, considering that's where the bulk of the cases are?
They go where the cases go, yes.
Governor, I have a couple of questions on with a very emotional doctor locally here in the 518 who tells me that they are out of hospital gowns, that they have no masks, that they are reusing hospital gowns that potentially could have been exposed to a patient with COVID-19 and without COVID-19. Response to that, message to them.
Look, this is a national problem, the medical supplies. States are scrambling all across the board. I'm proud of everything this state has done and the extraordinary efforts. As I told you, we have people on the ground in China. I'm calling people all across the world for these supplies. We have apparel companies that will go into the gown manufacturing business. We have to secure the material, which we're trying to do now. We're working on getting the New York State. New York State also manufactures uniforms. If I can get the material, we'll make them in the state. I have companies in New York where we're buying equipment, sewing equipment for them so they can manufacture them. But we have a gown shortage statewide.
I have a couple of questions.
It's not just Albany. It's worse than that. It's a gown shortage statewide. We're doing better with masks. We're doing better with ventilators. Nowhere near where we need to be with ventilators. We need 30,000 ventilators, so we're at 6,000. But at least we got the 6,000. The masks, the medical community has told me over and over again, the masks are the priority for the COVID-19. So we have made progress on masks. Gowns are also very important, no doubt. But we have not been successful as of yet with finding a supply of gowns, but we are searching high and low.
But with the number of masks, I think you said 2 million, right? The N95 masks, 1 million are going to the city. I forget the other numbers that you were saying, but what amount is staying here in upstate New York?
We have enough masks to handle all of upstate's need.
What does that mean, enough?
The numbers are very different between Albany and New York City, right? So we do the allocation based on where the cases are. And New York City, Westchester, Nassau, Suffolk, that's the locus of the problem. Masks for upstate hospitals, we can address that. We can fill that need as of now.
I have a couple of questions on testing. First of all, people are wondering, have you been tested?
Nope.
And why not?
Because I've not been exposed to anyone who is positive. I don't have a fever, I don't have any symptoms, and I don't want to waste the test.
The two major hospitals in Albany are saying they're not going to be able to test the members of the public, even though they have symptoms. They have to save it for the healthcare workers. Is that a concern?
The hospital, we are testing by the same protocol all across the state, Karen. If you meet that protocol, then you get a test. And it's on the website. If you have been exposed to someone positive, if you are showing symptoms, if you meet that protocol, you get a test. And again, we are testing more than any state in the United States of America. We are testing more per capita than China and Korea. So yes, no state, no country can give everybody a test who wants a test. But that shouldn't be the goal either. This is not just, I want a test to make myself feel better. And by the way, it won't even make you feel better because, okay, you didn't have a test at 10, you tested negative at 10 a.m. But then you went and you talked to 6 people, maybe you're positive again. You'll never solve that neurosis, right? That anxiety. But anybody who fits that protocol can get a test. And more people are getting tests in this state than anywhere else, and that is good news. And look, I'm very proud of what we did. We were all starting at the same place, and for us to come up to scale that quickly and get to scale where we're doing more than anyone else, that was great.
Governor, you mentioned that the 39-year-old healthcare worker from Iran is now doing well. Do you guys have a figure as to how many people have recovered and what the current death is?
We can get you those numbers. I don't have them with
Talk
me.
about the technical issue with the federal legislation. What do you mean by that? And is that in the House bill or the one that's being negotiated in the
The
Senate?
House bill that passed said, this is a little weedy, but the House bill that's passed said for a state to get the federal money, it can't make any changes in the Medicaid procedures. In this state, since January, I announced the MRT, the Medicaid redesign team. They issued their report that changes procedures in the Medicaid program. I've been doing that since January. We can't do a budget without changes to Medicaid. And by the way, you need changes to Medicaid because there's a lot of waste and inefficiency in Medicaid on those long-term programs, as we've been discussing for 6 months. They then wrote a bill that said, it's not really funny, it's like sad, but it's like either you cry or you laugh. They wrote a bill that said if you change any procedures on Medicaid, you don't qualify for the federal funding. Yeah, I know, but we've been changing procedures since January.
Governor, the 4 field hospitals you're talking about, are those essentially outdoor MASH units? What would those look like?
The 4 field hospitals, you have 2 types of, I call them pop-up hospitals, and they say, don't say pop-up hospital, which only makes me say pop-up hospital more. The field hospitals are done by the FEMA. They are equipped hospitals that do 250 people each. They're basically a tent configuration with beds, with medical equipment, with staff. And they come in 250 bed capacities. We requested 4 of those, so 1,000. The Army Corps of Engineers, they basically do a tent-like facility. They can do it in a gymnasium. They can do it in the Westchester Convention Center. They can do it outside, but then it needs an HVAC system, climate control system. That is more of just a tent structure itself without the beds, without the medical equipment, and without the staff.
So the field hospitals would be set up where? Would they be adjacent to hospitals, or would they be in parks?
We're talking about the field hospitals, the 1,000 beds in Javits, Again, if it works, if it fits, this is all preliminary. I have to talk to the Javits people about the electric service, et cetera. But 1,000 beds in Javits, and we don't have a number yet in those other 4 locations.
Governor,
Excuse me one second. Where's Gareth? Gareth, is that all correct?
yes.
Okay.
Governor, have you had any consideration of pulling maybe vulnerable people out of state prisons that may, if they get infected, it might spread like wildfire in there?
If we're watching that situation very closely, when we don't have a significant issue yet of spread in the prison system, we've taken certain precautions, we've stopped certain visitation, but if we have a problem, we'll address it, but we don't have that problem yet.
So you're not pulling people out yet. You're waiting to see what happens.
Right. If we have a problem, then we'll address it.
On those N95 masks, did the $2 million come from the state's own stock at this point, or is it?
No, those are 2 million that we are acquiring. How many, Simonita, how many new N95s have we identified to buy?
That's most of the stock, and we've been at this for weeks, and then yesterday, of course, we've had so many people reach out, and so we're sorting through that to get more. We're looking to buy in bulk, obviously, and get as much as we can.
2 million are the number of masks we can have identified to buy. Now, by the way, even when, just a little caution, these are companies who say, I have the masks, I will sell you the masks, I will send them by this date for this amount of money. And just so you know what's going on, masks that normally cost 80 cents are now $4, okay? These are 95 masks. But, look, it's price gouging, but we need them, and most of these are coming from overseas. But so far, 2 million new masks we've identified.
The 1 million that are going to New York City, how is the state determining which hospitals or health facilities get those?
There's a trade association called the Greater New York Hospital Association. That's what Ken Rasky runs. So between the voluntary hospitals and the public hospitals, they'll be distributed proportionately.
Governor, regarding the consequences to the state treasury, I agree that public health is job one, of course. I drove in here thinking about something Governor Mario Cuomo once said about advocates asking him to do this or that, fund this or that, and he said, you know, which SUNY campus do you want me to close? Yet Governor Carey once said that the days of wine and roses are over. So when these advocates are coming up in this climate, it seems to me that some of the press releases that I see, et cetera, are rather Pollyanna-esque, because that they haven't really fully adapted to this new reality. So is it a time for a reboot as to expectations as what the state can do for towns, cities, for all these groups that are out there relying on the state for funding? And do we need a pay freeze, for instance, which you probably can't do with the union contracts, but going forward, are we going to see some very heavy-duty measures?
Yeah, Joe, thank you for remembering my father. My father governed at a time where, frankly, you could be a little more candid and blunt, and he was. He also didn't have a lot of tolerance for frivolity or nonsense. Look, the advocacy community, their job is to ask for more money, right? Every budget, more money. Well, I'm giving you 100% more. It's not enough. I'm giving you 200% more. It's not enough. What number would be enough? No number, because I get paid to say I want more, right? And an advocacy organization, by definition, can never say it's enough, because then they put themselves out of business. To be advocating, and we did a budget proposal that was very rich to begin with. To be advocating for more state funding in this situation is beyond the pale of a colorable claim, right? The state is obviously broke, to use a term. The revenues are devastating. We're spending money on health care at an alarming rate. So, yeah, it's silly, it's trivial, it's petty politics. That's not just my father. Look, I've never had patience for the petty politics. I never have. It's not why I'm here. It's not what I want to do. It's not what I respect. And I've never had the patience for the petty politics. Neither did he. I'm here to do big things, to make the big changes, real issues. So I don't even take those press releases seriously in the first place, to tell you the truth.
Can you talk about the executive order to suspend speedy trials?
I can't really. Can anyone?
We signed an executive order a couple of days ago because the court system is currently shut down, and if we didn't address that, then cases could be dismissed on technicalities, and so it was an action we had to take. We did the exact same thing after Hurricane Sandy. Obviously, it was something we did not want to do, but given that the court system is currently not functioning, we had no choice.
On the 90-day eviction and mortgage question,
Sir?
are those mandatory orders to lenders and to landlords?
Mandatory. I made the point to Joe about petty politics. Look, from my point of view, 85% of the stuff we do is all petty politics. 15% matters. Minimum wage mattered. Marriage equality mattered. What we did on Superstorm Sandy mattered. Building airports matters. Building bridges matters. What we do here matters. What we do in this moment of time matters. This is government. If it's done well, it saves lives. That is not a rhetorical statement. It's not overly dramatic. It's government professionals who know what they're doing can save lives. It totally changed the lens on government. Oh, I thought government was about celebrity and who can tweet the most and who had the most Twitter followers. No, no. Now government is about, do you actually know what you're doing? Does your government actually work? Can you mobilize it quickly? Now, government is serious. Oh, wow, I didn't even think of this. And by the way, for a whole generation, they've never seen this. They've never had to see government really step up and function, right? That's where we are now. What should government do for the rest of session? It should do its job. This is the high point of government necessity and competence and performance and accuracy. This is when you need government to work like you've never needed it to work in your lifetime, with the highest consequences. And police officers are showing up at work, firefighters are showing up at work, public transit workers are showing up at work. You're telling me the elected officials can't show up at work? Come on.
And you still think they can come here and do it safely?
Karen, they can follow the same rules that apply to everyone, but can an elected official legislator do their job? Of course. Can a police officer do their job? Can a prison guard do their job? Can a firefighter do their job? Can a nurse do their job? Can a bus driver do their job? Yes. And certainly, an elected official can come to this cavernous complex and do their job. I'm going to work. Thank you, guys. So it was in their line of work. But the hand sanitizer is distributed to prisons, public transportation facilities, state government, local governments, et cetera. And we're increasing the production of hand sanitizer through Corecraft because we need it. The shortage has only gotten worse.
What's the state's new death count as of this morning?
Do you know that? 35 people.
How many people in New York City?
I don't know. I can get you the breakout. Do you know off the top of your head how many in New York City?
No, we had up there.
Do we have a range of the ages and
Was that up
people
there?
who had underlying health conditions?
I'm sorry, can you say that, Joseph?
Do we have a range of ages for those who have died and whether or not they all have underlying health conditions?
Primarily senior citizens.
Governor, we now know that Albany Medical Center in St. Peter.
Hey, Caesar. You're done.
All right, everybody, we are live and worldwide here for you on News Now and coronavirusnow.com. We are awaiting President Trump and the Vice President, along with the coronavirus White House task force. They will be doing a Saturday update. It was slated for 12 o'clock Eastern. It has been pushed back just by 30 minutes. So what we will do is get you some other coverage from around the country in just moments, and we will then bring you the very latest. You won't miss a step here as we are all awaiting President Trump on this Saturday.
New reality in this city, and we have to understand that this is something that's absolutely necessary. I want to say to my fellow New Yorkers, none of us asked for the coronavirus, to say the least. None of us expected the coronavirus. We are in a whole new dynamic. We're all learning every day how to make sense of it. And when I give you these briefings, and just like my colleagues, we'll try and be as blunt and straightforward as we possibly can be. But some of the time, the answer will be, we don't know, because we still don't know. There are so many things we're trying to sort out in a brand new reality. What I can say is a lot of the pieces are coming together to make sure that we do everything humanly possible to slow the spread of this disease, to give us a chance to prepare for the weeks ahead when we're going to see a lot more cases, to make sure our healthcare system will be as strong as it possibly can be. And that's why the governor's decision was so important, to make sure that all non-essential workers go home, that only people who are working are people who are doing something absolutely necessary for our city and our state, to make sure that people had some clear rules about what you can and cannot do. And we want to be clear about how we're going to enforce those rules. And you're going to hear from our police commissioner in a moment, and clearly the NYPD is going to play a major role in enforcement, along with other agencies that we depend on, like the FDNY, the Sheriff's Office. Many other agencies will be involved. But really, we want to emphasize from the beginning, I want to be clear that we're in a brand new reality. We have not gone through something like this across our whole city in generations. And our goal will be every single day to try what we think makes sense, to see how it goes, to listen to New Yorkers, to best understand what's going to work and what doesn't. I constantly am listening for the feedback I'm getting. People are reaching me from all parts of the city, giving me updates. I know my colleagues are too, and we're getting a real sense of what people need and how best we can serve them. But we are all trying to catch up with a new reality. So we will be enforcing the governor's order. The governor's order is the right thing to do to protect us all, and particularly to protect those who are most vulnerable, the folks over 50 with those pre-existing health conditions, and particularly folks over 70. Even if they're pretty healthy, those are the people who are most vulnerable. Those are our loved ones, our friends, our neighbors, the people we worship with, that we need to take care of. So acting on the state's order, we're going to do all we can to educate people, to help them understand how to live with this new reality, how to work together, how to support each other. It's not going to happen overnight. It's not going to be perfect the first time, but we do know that we're going to be able to help people understand how to make it work and that we all have to make it work. We all have to do this together. So you'll see folks from your city government, led by the NYPD, out there reminding people, educating people, warning people to make sure we get this right. So let me go over a few other matters, starting again with the state order. Again, starts to take full effect on Sunday night at 8. 100% of non-essential workers must stay home. But there are a number of industries and businesses that are essential. Those that provide food, groceries, obviously, food delivery, pharmacies, mass transit, healthcare. Those are the areas that, of course, will be protected. We'll keep going. But I think it's as simple as this. If you don't need to be out, you shouldn't be out. And if you can be home, you should be home. That's what it really comes down to, especially for those folks most vulnerable, as I mentioned. You know, folks who at this moment are vulnerable to this disease. Let's just think about it. We don't want them to take any chances whatsoever. If anyone in those categories wants to go outside for a little bit, I get it, but please, absolutely distance from anyone around you and as briefly as possible. Really limit the people who come in contact with you. No one should come in contact with anyone over 50 with those pre-existing conditions or over 70 in general without checking first to see if you have a temperature. Use a thermometer. If you have a temperature over 100, you should not be in contact with anyone in those vulnerable categories. People have to be really smart about it and always practice social distancing. That's 6 feet apart. Wherever you are, except when you're right among your own family members. You go out for a walk, stay 6 feet apart from people. You go to the grocery store, stay 6 feet apart from people. Anything you're doing, keep to that rule. Does anyone think it's going to be perfect? No. But if you keep thinking all the time and acting all the time, you'll be able to protect yourself. For folks who were planning gatherings, obviously we're quite clear, and it's tough to say. There's so many gatherings we look forward to each year. Anything non-essential should not happen at this point. It just has to be postponed. The core of this crisis will certainly go on for weeks, most likely months. If you have to postpone, you'll be postponing for a while. But it is the right thing to do to keep people safe. And I remind people that's true outside as well as inside. That 6 foot apart matters in either situation. We want to make sure people remember, even when you're doing those basic things, going to the grocery store, going to the pharmacy, you still need to keep 6 feet apart. And again, we're going to ask the NYPD and other agencies to keep an eye on places where people are getting a little too crowded and to go in and remind people to separate and spread out. I don't think most New Yorkers need a lot of reminding of what this pandemic means and the dangers it brings. But we're all human beings. We're social. We're used to being close together, especially in this city. I know the NYPD and others will do a great job of making sure we're reminded to do the smart thing and the healthy thing and the safe thing. Okay, let me now talk to you about the overall situation. And this is the part of each briefing that I really hate to give because it's just astounding and it gets worse each time. But my job is to tell you the truth, and my job is to tell you the facts that you need to know. So here we go. As of 10 a.m. today, we can confirm in New York City 5,151 cases confirmed of coronavirus. And to give you perspective, that is now about 1/3 of all the coronavirus cases in the United States of America. It is about 2/3 of the cases in the state of New York. I hate to say this, but it's true. We are now the epicenter of this crisis right here in the nation's largest city. And we have so much we have to do. The city, we are doing everything that we possibly can. People are giving us ideas every day. We're running with those ideas. We're trying to create new things to help people. Our public servants are doing an amazing job. A lot of people are coming forward from the private sector offering help, from the philanthropic sector. There's so many people offering help, from individuals like those amazing medical professionals who have come forward, over 2,000. Those retirees who have volunteered to come back to help. Business people, big and small, offering to give anything they have to help this city. So many amazing positive stories. And that reminds me just how good New Yorkers are and how much we're going to really find a way to get through this together. So the city government's doing everything it knows how. New Yorkers, businesses, nonprofit organizations, community groups, houses of worship, everyone's chipping in. State of New York doing the right thing, the right policy to protect us all, and taking a lot of the other right moves to be careful to make sure we all get through this. Everything makes sense until you get to the federal government. And I still can't understand it. Every day that I talk to you, I cannot understand what's going on here. There was another big press conference by the president and his key officials. They were talking about what is undoubtedly one of the biggest crises in this country in generations, one of the biggest threats to our national security in generations. And yet, essentially today, the president offered no new evidence of action. I don't understand why he won't do the single simplest thing that would help us and help this whole country mobilize our armed forces. We need their ability, their logistical ability, their operational ability, their extraordinary personnel, including their extraordinary medical personnel. We need them here. We need them now. It's as simple as that. And the order still has not been given. The same with the Defense Production Act. We have been waiting and waiting. The president said today he would utilize it, but there's no specific evidence of that confirming to us any specific supplies or equipment being built, manufactured, distributed. We have nothing yet to tell us when we're going to get help, and we need it. I continue to appeal to our congressional delegation, which has been very supportive. I'm reaching out to cabinet secretaries. I'm reaching out to the vice president, anyone who will listen. But we need the president's full authority utilized under the Defense Production Act so that it will actually turn into thousands of ventilators, millions of surgical masks, all the things that New York needs. And by the way, I've warned people, in 2 or 3 weeks, at this rate, we're going to run out. But that's the beginning of the crisis. Later in April, into May, it gets worse. So we need the federal government to act. Senator Schumer, to his credit, is playing an extraordinary role. He has offered this Marshall Plan for hospitals. That's exactly what we need to give our healthcare community what they need, the supplies, the equipment, everything they need. But listen, it also, to his great credit, recognizes that states and localities are right now bearing massive new expenses and are stressed in huge ways, and we need the financial relief too so we can help our people. And our people need money back in their pockets, and the federal government can do that. So again, thank you to Senator Schumer for all you are doing. I want to give a number of updates about actions quickly that the city is taking, and then I'll turn to our police commissioner and then our school's chancellor. Let me just say, I mentioned earlier the sheer number of cases. Again, 5,151, an astounding number. 29 people in this city have passed away because of coronavirus. We've lost 29 New Yorkers, and that number is sure to keep growing very, very sadly. In terms of the boroughs, we have 1,406 cases. This again as of 10 a.m. this morning. 1,406 cases in Queens, 1,518 cases in Brooklyn, 1,314 cases in Manhattan, 667 cases in the Bronx, and 242 cases in Staten Island. Let me tell you about some of the things we're going to do, and the Chancellor will go into more detail on the question of our enrichment centers. These are the new centers. We've never had them before. This is a brand new thing. And I want to thank everyone at Department of Education, everyone, our educators, our staff, our senior leadership, everyone. These folks have been working nonstop to get this ready. And these are the enrichment centers to provide education and to give a safe place to the kids of our absolutely essential workers, our healthcare workers, our first responders, our transit workers. We know we need all of those workers at the front where they're needed most, and they need to have their kids someplace safe. So they will open up on Monday morning. There'll be 93 to begin, but we could well be adding more. 76 of those will be K-12 education centers. 17 will be early childhood grades only. And these sites can handle well over 50,000 students. It's not going to be anywhere near that number to begin, but it could grow much more as we go along, and we want to be ready for anything. The first group, of course, again, is healthcare workers, first responders, transit workers. I've identified them before. All of them will be able to, once confirmed, of course, will be able to have their kids go to these schools and centers during the school day. For the Department of Education staff who will be working at the centers and the food distribution locations, I'll be talking about those in a moment. Of course, their children as well will have that opportunity. For the frontline investigators and child protective workers in the Administration for Children's Services who protect kids against child abuse, the same. For Department of Corrections essential staff, the same. For Department of Homeless Services and Human Resources Administration, shelter staff and key contracted staff, the same, and for sanitation essential staff. And that obviously means, in the case of corrections and sanitation, our frontline workers as well. So we will be getting all the details out on the different categories of city workers and other workers who qualify to have this opportunity for their kids. Those categories are not final, meaning we will reserve the right over the next few days into next week to add as we see what's going on, as we hear from additional folks what they need. I mentioned the feeding sites. We're going to be doing a lot of work in these next weeks and months on new ways of feeding New Yorkers. In terms of feeding, in this case, we mean grab-and-go meals. So this is not people sitting down. Of course, we're trying to enforce social distancing in every way we can. So the grab-and-go meals will be for any young person under 18, whether they go to a public school or any other kind of school. 435 sites will be opening on Monday. They will serve breakfast, lunch, and dinner. A young person can come and get all 3 meals at once or any combination for limited hours in the day, on the early part of the day. Details will all be posted. We've got, this is based on sites that were either part of our summer food program from last summer. About 100 of those sites are being used here. A number of other sites where we see a very high level of kids who during the school year get school meals at a reduced rate or free because of their status economically. We're also going to have a special initiative to get food to the homes of medically fragile students. Those are students who really need particular help. Department of Education is going to have a special plan for them, and we're working with DoorDash, and we want to help them, we want to thank them for their help in making this possible. Everyone who stepped up to make these feeding sites possible, I want to thank all of you. There's a lot of public servants, everyone out there, I just want to say a lot of public servants who know it's a tough situation, there's a lot of fear, there's a lot of anxiety, but they're stepping forward anyway to help their fellow New Yorkers, and I want to commend all of them. Some other quick updates. There have been real questions about the small business grants and loans that we announced over a week ago. Want to make sure we're clear about how that works, and I want us to do a better job of keeping this information straightforward and clear for small business folks who need them going forward. The grants for businesses with 5 or fewer employees who have lost 25% or more of revenue. That application has been online and live since last Tuesday. And we have now 466 applications. They will all be processed by Monday, and money will go into people's bank accounts on Monday. For the businesses with fewer than 100 employees, and those that also lost 25% or more of their revenue, there's a huge demand for those loans. We are not going to be able to meet the full demand immediately. We'll do our best to reach as many as we can. Initially, that's about 400 businesses as well. Those businesses will be able to process their applications tomorrow, beginning tomorrow, and the loan money will be in their bank accounts by the end of this coming week. So that one we're still playing some catch up on, but we should have money in people's hands by the end of this coming week. On our city parks, this is another one that pains me. Again, I'm a parent. I love our parks for my own experiences with them, but also all the time I spent with my kids in our parks. It pains me to tell you we have to cancel all field permits We cannot allow any events. We cannot allow any team sports. And I'm someone who loves team sports in every form, and I'm very sorry to have to tell you that, but it's just, unfortunately, pretty much all team sports come with people getting in close proximity, and that's how this disease spreads. So we're not going to be able to allow any permits for that. We're going to urge everyone to exercise on their own and socially distance to the best of their abilities. And parents are going to have a tough time with this, and kids are going to have a tough time with this, and it's not going to be perfect. But do the best you can to live in this new reality. Again, is it going to go on forever? No. It will be a certain number of weeks, a certain number of months. We don't know exactly what it will be, but it will not be forever. We know it will be finite. We know this crisis will end. So it's going to be a tough, tough adjustment, but we have to be clear about keeping people safe. There's been real good questions about bike lanes and bike usage. There seems to be a real surge in bike usage. That's fantastic. We want to support that. We're going to begin by installing temporary bike lanes, hopefully by the end of next week. First of all, an area very, very important, 2nd Avenue, Manhattan, between 34th and 42nd Street, a temporary bike lane there. Also on Smith Street in Brooklyn, part of Smith Street that does not have a bike lane. We'll put in a temporary one there. We'll be looking for other areas all over the city that need them. We certainly want to encourage people to use bikes as much as they can at this moment. And we'll have constant updates on that. Now, when it comes to another way that people get around our ferries, we do have, unfortunately, we do have to reduce some of our ferry service because there simply isn't a ridership to, justify the kind of frequency we have now, and we have to be smart about that. Every resource right now has to be used best to fight coronavirus. Every part of the city government has to support every other part. So we will have to reduce frequency because we just see many fewer people. Staten Island Ferry ridership is down 70% compared to the same point last year. We will still have ferry service, but we need people to, of course, be smart about social distancing, and they will have fewer trips, and so we have to be really smart about keeping an eye on that, keeping that balance. It will not be a huge change. We'll be reducing weekday schedules from 4 to 3 boats during rush hours. So you'll still have regular service. It'll just be somewhat less. And that will go into effect this Sunday at midnight. The same for New York City Ferry. NYC Ferry reductions will begin next week. We'll get the exact details. Obviously, we will be careful to protect the times that people need the ferry the most during morning and evening rush hour. But there will be reductions in that service, details to be announced. So, concluding, and then a few words in Spanish. Look, just to say anyone out there is confused.
Hospitals, the schools, and the many facilities in the Board of Ed that will be open for both children and for picking up breakfast and lunch. So that remains a focus point in the next period going forward. In terms of the grocery stores and the bars and the restaurants with these new orders of closings, certainly the food establishments and the grocery stores remain open, but we also ask for continued cooperation in terms of just managing any volumes of people. The good news is we consider about 500 locations that I would categorize as large establishments throughout New York City. We have been to them all, and we have not seen any major problems. We have issued very few summonses to any establishments because of the level of cooperation that we've seen. So it's about education, it's about working with each other, and it's about the social distancing that Dr. Barbeau has been preaching now. Seems like years, but it's really about weeks. So we will continue to work with the communities that we serve every day to keep continuing to spread that word. We ask for your continued cooperation at this time of certainly stress for all New Yorkers, but again, thank you for all the cooperation.
Thank you, Commissioner. I just want to thank you again. Men and women of the NYPD have been outstanding in this moment, and really want to thank you for reminding people. Again, this is one of the leading, I would argue, the preeminent public safety official in the United States of America, and what he's saying here is that, in fact, what the NYPD is finding is the vast majority of New Yorkers are abiding by the new rules even before today, are being clear about their responsibilities to each other, responsibilities to their community, and are listening to the constant information that they're getting about coronavirus and taking it seriously. So I actually think as we go into this new phase with the new plan put forward by the state, that New Yorkers adapt to it quickly. And the NYPD will be there to help. And if anyone needs a reminder, they'll get that reminder. If anyone needs to be reminded that you got to stick to the rules and keep moving along, NYPD will do that. But I think New Yorkers are ready to listen, and their respect for the NYPD is great, and for all the other agencies that will help with the enforcement. So thank you very, very much, Commissioner. Appreciate it. And we all share with you, the thoughts and prayers for your members who are ill, particularly the member who's hospitalized. And that's true for all of our public servants who are dealing with these challenges now and all their families. I want to turn to our school's chancellor now to give an update on what is starting Monday. And as he comes up, Chancellor, I have to commend you again and your team. You were asked to do something that's never been done in the history of New York City before, and you were asked to do it in a week's time. And I know it won't be perfect, but you and your team have really done an extraordinary job moving mountains here. And a lot of kids and families are going to benefit, and a lot of kids are getting food right now because of what you and your team have done. Thank you. Please.
Thank you, Mr. Mayor. So I want to echo what the mayor has talked about, what our police commissioners talked about, what Dr. Barbeau has talked about. This is a time to be aware. It is not a time to be panicked. It is a time to follow instructions. And I've been so inspired, Mr. Mayor, as I've been out in the city looking at the professional development, but more importantly, speaking virtually with many of my colleagues across the system. When you think about in a matter of days, the largest school system in America is going to completely switch its instructional delivery method in a matter of 3-4 days. That's unheard of, and it's only possible because of the incredible educators that we have in our schools and leaders that lead as principals and the support team that we have in place. I'm also going to take just a moment here to say thank you to our custodians, our school safety agents, our school food and nutrition workers who have all shown up every day without fail to make sure that our students have what they need, whether it's food, but we have clean facilities that are disinfected and deep cleaned every single day, and keeping our buildings safe and secure as well. I want to thank them. I haven't heard one complaint from them to say they don't want to come in, so I want to thank them for what they do. Our school teachers and administrators as well, we're about to go into the very big unknown. But we're excited because there are many schools in New York City that have already had some version of virtual learning, distance learning, remote learning. But this is an opportunity for us to take this to scale. So I'm thankful that on Monday we will switch to a remote learning model where our students will continue to be able to get the instruction they need over the next few weeks, hopefully not months, but whatever the time period is, we will be able to continue to have them engaged academically. It doesn't mean that there won't be hiccups. And Mr. Mayor, I appreciate that you have said we are in uncharted waters and there will be hiccups. But the good thing is that we all recognize that good is not going to be the opposite of perfect. And we're going to continue to work through those hiccups as we build this new instructional
Perfect is the enemy of good.
Perfect is the enemy of good. Yes, sir. So there will be hiccups, but we're going to keep the lines of communication open. But not only will students be transitioning to remote learning on Monday, but across the city, and you mentioned this, sir, 439 buildings will serve 3 meals a day to any student that wants one. No identification is required, no identifying what school you come from. If you show up, you will be able to get not only breakfast and lunch, but also dinner, all at one stop. Now, you mentioned that these sites were specifically chosen. 100 of the sites were chosen because they were high participation sites in summer of 2019, and the remaining sites are schools where more than 50% of the students are eligible for free and reduced lunch. So we're trying to be very strategic in terms of where we locate these sites. To find a site near you, it's very easy. Just search free meals on the DOE website, free meals, or you can call 311, or starting Monday, you can text food, F-O-O-D, or comida, C-O-M-I-D-A, to 877. That's simple.
Say the name of the DOE website.
It's www.nycschools. So please, it's that simple, 311 or texting to 877-877, food or comida. We're also opening 93 regional education enrichment centers serving up to 57,000 students whose parents are on the front lines serving our city, including first responders, healthcare workers, transit workers. We will also be serving the essential staff, other essential staff, including sanitation workers, DHS and HRA, shelter staff, ACS staff, and obviously the DOE staff that are reporting to the regional enrichment centers and serving food all day. 76 will be K-12 centers and 17 will be early education childhood centers. And again, we want to thank our first responders and our essential workers for keeping our city going. Students at these educational enrichment centers will be there from 7:30 a.m. till 6 p.m., and they will participate in remote learning with their school as well as any art or physical education activities that we have. I personally have been blown away by the fact that we have 2,000 volunteers that have thus far volunteered and signed up to staff these centers. We've also heard the call to expand the eligibility for these centers, and we are evaluating in the coming days and weeks our capacity to be able to meet that need as well. So the work isn't going to be easy, and it's probably not going to be flawless, but I am very proud of the work and the labor that my colleagues in the Department of Education have put into making sure, with a compassionate heart, that our 1.1 million students will be served for either weeks or months, but they will be served. We have a long road ahead, but I'm confident that together we will be able to make this a reality for all of our students.
Thank you very much, Chancellor. Now we will turn to Olivia, who will be our moderator. Go ahead, Olivia.
So just a quick note at the top for folks. We want to get to as many people as possible, but in order to do that, we ask that you limit your questions to 2 max. And with that, we're going to turn it over to Yoav for the first question.
I see we have reverse alphabetical order here. Go ahead, Yoav.
Changing it up on a Friday.
Hi, so 2 questions. One, we seem to be hearing about a surprising number of younger people who are hospitalized and even in the ICU, and supposedly many of them do not have preconditions. I'm just wondering if your health department is seeing that, and whether there's any consideration to changing the messaging so that perhaps some of the healthy young adults don't continue to think of themselves as very low risk personally.
So let me start off by saying that from the beginning, we have made clear that even though the individuals who are most at risk for bad outcomes are people above 50 with chronic underlying illnesses, we have also been saying that they're not the only ones who are at risk, that certainly we have had young people not only infected, but also have been ill. We have not seen a large number of young people hospitalized, but the reality is that, and I just want to sort of take a pause here because we are in a somber moment in this outbreak, right? We've gone from a period of 3 weeks of having single-digit cases to then having double-digit daily cases to then having triple-digit daily cases, and now we are in the thousands every day of new individuals infected with COVID-19. So it's inevitable that there will be individuals infected with COVID-19 that represent the spectrum of New Yorkers, from the young to the very old. And certainly, the reason why I have such urgency with people staying in their homes is because every time New Yorkers go out unnecessarily, they are adding potential flame to the fire of spreading COVID-19. And my concern is that right now we are in the single digits, thankfully, single digits of people dying, reporting dying every day. But I wouldn't be surprised if we get to a day where we have double digits, new people dying every day. And so it's incumbent on all of us, young and old, and especially the young who may think that they are invincible, to stay the heck indoors. Every time they go out unnecessarily, it puts others at risk. So thank you for that question, because I want New Yorkers to be clear that no one, and I've said this before, but it's an opportunity to really hammer home the point, no one literally is immune to this. This is a novel virus that we have never seen before, and everyone is at risk for being infected. Thankfully, what we've seen is that, 80% of the people who do become infected do have mild courses, but the reality is that there are and there have been and there will be young people who have bad outcomes as a result of this. So it's incumbent on all of us to do our part, to take personal responsibility for our behavior, to be civically responsible, to stay indoors, especially if you have symptoms, and to only go to the doctor if you're getting worse.
Okay, thank you. And one other question, just wanted to get some clarity that there appears to be kind of new directive from the health department that says, quote, outpatient testing must not be encouraged, promoted, or advertised. And I'm just wondering, because there was a kind of a drive-through, I forget what you call it, a drive-through testing site on Staten Island. I don't know if that was set up by the city or state. But given that directive, would the administration like to see those drive-through efforts stopped?
So again, we have been clear that testing is best indicated for people who are symptomatic, have chronic underlying illnesses, and are not getting better. To the extent that health systems are using these types of testing sites to offload volume from their emergency departments, then that we think is okay. But we've been clear from the very beginning, we do not encourage and we actively discourage asymptomatic people from getting tested because it's squandering scarce resources, not only in terms of tests, but also in terms of the personal protective equipment that's required by healthcare workers when doing these tests, which include masks, gowns, gloves, all of which we will desperately need as this epidemic continues. We are only at the very beginning, and so it's incumbent on us to protect those valuable resources, and testing asymptomatic people is a waste of time.
Yeah, and so, Yoav, any testing center set up by the city or state is working on a priority basis and a reservation basis. That's the standard we're working with. Our two health commissioners, city and state, talk constantly. What we have all agreed to is on the testing centers we've announced around health and hospitals facilities. You call, you speak to a clinician, they determine if you need testing. If you're a priority person, you get a reservation. This is the way it's going to go for testing for the foreseeable future. Until and unless we have a really, really substantial supply of testing and we can have different standards. But that is clear, and I do think to make clear to folks that, 80%, this continues to be seen in the statistics, 80% of people have a mild experience. For those folks, if you stay home, if you're able to ride this out, you may never need to be tested. And we have to be clear that that is, in an imperfect situation, that's a virtue if folks can. And we actually, bluntly, a lot of people already have, some of them didn't even know they were sick with anything special. I mean, we know this, that some people have had this disease and had a very minor impact from it and just rode it out. Other people we know are in tremendous danger. So we have to keep focused on where the need is greatest, and that's how the testing programs will go. Go ahead, Olivia.
Matt Chase, you're up next.
Thank you, Olivia. Mr. Mayor, I know you're in close contact with the governor and you've been working very closely together, but I'm looking for you to be specific about the extent to which his executive order that he signed on Wednesday limits what you as mayor can do, and also how it limits what you can do under the 2 orders you've already signed. And then I have a question for the police commissioner once you've answered that.
Yeah, Matt, I think everything that we have done previously it continues. The state, to the best of my knowledge, agrees with it. There's nothing changing on the actions we've taken so far. And the governor's order is for the entire state. And I think it's a very simple way to characterize it. It says that localities need to defer to the state, and if we want to do something specifically, we go to the state, we talk it through. If there's agreement, either the state's going to do it or we're going to do it, but it's going to be done with common understanding. That makes sense to me in a time of crisis, so that's how we'll operate.
Thank you very much. And for Commissioner Shea, assuming your officers ask nicely and a person is not on an authorized outdoor excursion and is intransigent, what will the response be for failing to obey?
There's a range of available methods that can be taken. You know, and ultimately, summons and arrest is one of those options, but that's the last resort. And as I stated when I opened today, what we have been encountering from the beginning of this is overwhelmingly cooperation. When you look at the summonses that have been issued, when you look at the initial things that were put into place regarding bars and restaurants, single digits in a city of 8.6 million people. And not only single digits, I think closer to 2 is, I believe, the last number I saw. So certainly with anything that we put into place in New York City, there are many laws on the books, but we start with a conversation. And we progress from there. And by and large, what we have gotten is cooperation, and we anticipate more of the same.
Mark Morales from CNN.
Go ahead, Mark.
Hey, Mr. Mayor, how are you, Commissioner? Just had a couple of questions. Actually, I had 2 questions for the police commissioner. The first was, is there going to be any plan to, say, go into a place like Prospect Park, for instance, that just seems like it's very crowded, and either kick people out of the park or reduce how many people are there? And the other question I have is, does the department have anything like a pandemic plan in place? And if it does, what are the elements and how's that being implemented?
Let me jump in on the first part, because we are obviously putting together our approach. This action by the state is very new. Again, I agree with it fully, but it's a new reality we're going to acclimate to. I know Prospect Park like the back of my hand. I've spent decades around it. If you think of a very, very crowded Prospect Park, the goal is not to kick people out. The goal is to get people to create some distance and some space from each other. There's already officers who patrol in Prospect Park. They'll go and say, if there's people getting too close together, spread out. And, find there's lots of different parts of the park, spread out. Make sure you're safe. And we'll be doing that all over the city, and wherever we can find opportunities to open up additional spaces. One of the things I want to make sure we're working on is schoolyards, for example. We want to maximize spaces for people, but the goal is not to kick anyone out who's getting some exercise. The goal is to space them out and to make sure that people don't linger too long, because the goal, of course, is once you've gotten your exercise, to get back home. You can take the rest, Commissioner.
And in terms of the second part of the question, when you talk about planning for a pandemic, that's what we do. We plan for large-scale events. When you look at tabletop exercises, when you look at organizations such as the NYPD and how we plan with the fire department, EMS, Office of Emergency Management, and all of the partners. And that's whether it's for a terrorist strike, whether it's a New York City Marathon or any other event. Certainly this coronavirus that we're seeing now is a new page, but many of the things that we are seeing now are things that we have quite frankly planned for in terms of immediacy, in terms of going into hot zones and working with our partners, in terms of planning for longer term outages of water, food, electricity. So we're pulling this all together. This is a very, very fluid situation that we're involved with, but as I said, whether it's patrol strength, switching to 12-hour tours, dealing with less resources. These are things that we plan for the worst on a daily basis. And I think that much of that planning is proving very useful today.
Amen.
Thanks, Mark. Up next is Julia. Julia, you're up.
Hi, can you hear me?
Yes.
Hi. Kind of related to Yoav's question, the City Health Department, maybe this is a question for Dr. Barbeau, put out demographics that found most of the city's positive cases are men between the ages of 18 to 49. Can Dr. Barbeau discuss why that is?
So I think it's too early in the outbreak to make any informed opinions about what that might be, but it does draw attention to the fact, as we have said in the past, that we are encouraging those in that age group who are not symptomatic not to be tested, and that we are encouraging folks who are mildly symptomatic to remain home. You know, I know that recently there have been reports where worldwide it seems like men have worse outcomes than women. Again, I think it's premature to make any sort of inferences on what that might mean because, especially here in New York City, we're only at the very, very, very beginning of this outbreak. And while, for example, places like Italy, you may see that disparity, in places like Korea, it's a 50-50 split. So I think it's too early to tell.
Thanks, Julia. Do you have an additional question or a follow-up?
I don't, thank you.
Thank you.
Thank
Up
you.
next is Joe Anuda.
Who's that?
Joe Anuda.
Joe?
Joe, you're up.
Joe?
Okay, we can't hear Joe. Joe, we'll come back to you. Jennifer from the AP is up next.
Hi, can you hear me?
Yep.
Thank you, Mr. Mayor. This is actually a question for the school's chancellor. I was wondering if you could enlighten us a little bit more about the nuts and bolts of what the preparation for remote learning has entailed, both technologically and in the teacher training and in communications with families.
Sure, so thank you. So it's important to recognize that, as I mentioned in my comments, there are a number of schools in the New York City Department of Education that are very, very far along this path, have been doing this for a while, have very sophisticated systems and structures, and have really done a great job. We've been trying to capture those best practices as part of our ramp up as well. And then we have some schools that this is the first time they will ever try remote learning. So we do have a differentiated group of colleagues out there. So in order to do that, what we've done is we've created tutorials for all of our teachers. We've vetted and curated lots of different virtual, not only learning sites, but also activity sites. We're working with a number of partners, third-party partners that have great resources. Everything from being able to take virtual trips to do virtual treasure hunts, and then students get to write about it. They're all grade specific, they're grade aligned, standards aligned. We have given guidance and will continue to give guidance to teachers around being able to, for example, structure a learning day so that students have multiple opportunities to explore different content areas. A student in middle school or in high school, for example, may have a math assignment, and if they are having difficulty with that math assignment, there's a hot link in their Google Classroom where they can click and go to the Khan Academy and get a tutorial on how to solve for those issues. That's the kind of support that we're trying to provide for our teachers. And I have to say that a number of the things that we've been able to curate are coming right from our teachers as well. So this has been a good discovery process for us. For parents and for students, it is also a shift in the learning environment for them. So we're putting guidance out to parents in terms of what they can do. And parents can be as involved or not in terms of guiding what their children are doing in this environment. We're going to ask that parents do support us and make sure that they understand that we want students to participate in the remote learning activities. It's only going to benefit them. But we also recognize the fact that parents are under a lot of stress right now. And we know that there's multiple things happening in family dynamics. So we understand that as well. But we just want to make sure that parents and students and teachers have what they need to be able to have robust learning that happens in the very near future. One last thing that I'll say is that we are also paying special attention to our vulnerable students. So students with disabilities, our English language learner students, our students that are homeless. So we have very specific plans that teachers in their schools are working on with those students. For example, students with disabilities, they're being reached out to. They've been reached out to this whole week, and they're developing certain ways of working with those students. Some of them you would expect to be easier than others. For example, students that need speech therapy, you can do that in a virtual environment rather easily, but students that need physical therapy, it requires a whole other dynamic. So it's not a cookie cutter approach, and we're working through those issues right now. We also are addressing the device and the digital divide between our students. We have about 25,000 Wi-Fi enabled computers that we're starting to distribute on Monday, and we'll continue to. We have others already planned. Schools are using their own stock of computers that usually stay in the school, and they're assigning them to students to be able to take home. A lot of moving parts. And I know I gave you a lot of information, but very complex implementation. I'm really proud of our team.
Back to Joe. Oh, sorry, Jennifer, continue.
Thanks for that. And following on that, I know that there have been some students who tried to pick up a device this week and were unable to. They ran out or what have you. What guidance are you giving them for what they should do until next week comes, if they don't have the equipment on Monday?
Yeah, so I'm going to encourage all families to stay in close contact with their school, because the school will have the most up-to-date information pertaining to their particular distribution. And remember, devices are coming in all the time. But we also have more than 2 weeks worth of paper and pencil assignments and activities and packets that are available as well. Those will be available at the hubs that I spoke of, where parents and students can come and pick up breakfast, lunch, and dinner. They can also pick up assignments. So again, it's very simple, www.schools.nyc.gov. There is a link right on the homepage there that will take you to home learning, and it has lots of information. You can also call 311, and we'd be happy to help.
Up next is Jeff Mays, then we're going to go back to Joe. Jeff?
Yes, this is for the commissioner. There have just been some calls for the NYPD to cut down on low-level enforcement, and some district attorneys have said they will not prosecute such arrests. Does the NYPD plan to curb some of its enforcement activity, or have you already begun to do that?
So if you look at where we are in New York City, we've dramatically cut our enforcement over really the last 6 years. I'm very comfortable where we are right now in terms of policing in this city. It continues to evolve. As I said before, the primary focus that I want to get out today is the men and women of New York City Police Department are out there. They're out there to keep people safe, whether you're a crime victim or whether you're a person dealing with this crisis. And we're going to continue to do that.
But have you cut enforcement?
I'm sorry?
But have you cut enforcement?
Not because, I'm just clarifying, not something different because of what's happened the last few weeks.
We have no intention of strategically cutting enforcement specifically related to this coronavirus. But as I said before, we have, through precision policing, exhibited what I like to think is the best policing model in this country for the last 6 years, and we'll continue to do that.
Yeah, Jeff, I want to add to that. I think there's we got two historical trends kind of coming together here, and we got to understand that the 6 years of nonstop adjustment. And I always remind people the day Bill Bratton said to me, it was a very revelatory day for me, learning from one of the great police leaders of our time. And he said, arrest is just one tool. And obviously, some years ago, before this administration, arrest was overused and stops were overused. And what Bill Bratton said is we need to understand that arrests have a place, summonses have a place, warnings have a place. They're all different tools that police can use, but really what you need to do is treat police officers as the professionals they are, train them constantly, support them constantly, give them discretion. And honestly, in the past, and the commissioner knows much more than me, went on the job in 1991,
That's right.
in the South Bronx in a tough, tough time. But in truth, for a long time, our officers were not given the respect to get the kind of training they deserved and the opportunity to use that training and that discretion. When you combine that with a constant devotion to reducing unnecessary arrest, reducing stops profoundly, turning to summonses more and warnings more while keeping people safe. And we do know, notwithstanding the last few months where we've had some aberrant realities, overall we're at the safest point in New York City since the 1950s. That 6-year trend was already highly established, deeply established, before coronavirus became a major reality in our lives in the last few weeks. So I would argue the adjustment already happened. And there's not a lot of additional adjustment that needs to happen. Our police officers are going to obviously focus now in this new reality starting Sunday on educating and warning and helping people do the right thing. But we also have to keep people safe. And the commissioner and I have talked a lot about the last few months, and we saw some things we did not like that we have to address, and we have to keep an eye on that. I'm heartened to hear that crime has gone down recently, obviously interconnected with the last few weeks. But Jeff, I'm just trying to put that all in perspective. I think we would argue that we got to a good balance point, and we're not moving off that simply because of what we've seen in the last few weeks. We'll continue to watch. If something changes, we'll cross that bridge when we get to it. But I think we feel good about where we are.
Back to Joe. Joe, you're up.
Okay, can you hear me this time?
Yes.
Yeah.
Okay, great. Hi, Mr. Mayor. I had 2 questions for you. The first, I don't know if you've seen, there's this new data analysis out there that says hospital visits will overwhelm capacity next week. I think this gentleman, Michael Donnelly, is predicting 3,000 visits by Tuesday, 8,000 by Friday, and 15,000 early next week.
I'm sorry to interrupt, Joe.
Give us an update.
Joe, I'm sorry to interrupt, just to make sure we're speaking the same language. When you say visits, do you mean hospitalizations?
Hospitalizations from coronavirus, yes.
Okay.
And I'm curious if you could just give us an update. I know there are lots of plans to bring additional capacity online. Where are we today? And sort of, can you give any specifics about when we'll see some of the reserves brought online?
I'll start and then pass to Dr. Katz. Joe, I've only had a glancing sense of that particular projection. There's a lot of projections that are being looked at right now. But what I've said over the last few days, I think, is the summation, the sort of simple version of the projections that we're seeing, which is for the remainder of March, we believe our hospital system in its current state can handle what is obviously a very, very intense surge of cases. When I mean our system, and again, Dr. Katz and Dr. Barbeau will refine what I say as experts, but that our public system and our voluntary system, having now shed a huge amount of activity with the end of elective surgery and ending people's hospital stays appropriately earlier where they could, they have a lot of capacity opened up and have obviously been preparing. And we believe, over this next week or two, we're prepared to handle that. I've been very blunt about the fact that after 2 weeks or 3 weeks, we get into a whole new reality. And that's where we not only need that expansion of space, but we need that expansion of supplies and equipment to start reaching us. We have, as you heard, about 1,200 additional beds we're bringing on rapidly. Some of those will be as early as this coming week. A huge amount of space has been offered us in the hotel industry and others. Deanne Criswell is here, our emergency management commissioner. Her team's coordinating that. We are going to be literally bringing stuff online as quickly as we can, but I think it's safe to say that next week will be the beginning of new capacity, and then it'll just be rolling over weeks and weeks. So as we get specific numbers, I think, as we get into next week, we'll be able to start putting some specific dates and numbers to it. But I do feel that next week, for sure, our system has the capacity it needs. Dr. Katz.
Well, Health and Hospitals, which runs 11 acute care hospitals, is very much dealing with the dynamic that you're speaking of and that the mayor has spoken to. We have been able to open up capacity in the ways that the mayor has spoken. We're also
All right, folks, and now we are live and worldwide here for you on coronavirusnow.com. You can see part of the task force is there, and we are now just moments away from seeing President Trump and the Vice President and other leaders of the coronavirus White House task force, as we will be now getting a Saturday briefing. It's now an everyday occurrence here at the White House, something that, before this whole coronavirus pandemic, we didn't see White House briefings inside this briefing room. It was pretty much President Trump would make statements on a pretty much daily occurrence, but it would be from either in the Oval Office when he was meeting with other dignitaries, or it would be when he was traveling to other states to do a rally or to do other official presidential commitments. Now we are seeing the briefing room really being used, and now we are just now moments away from President Trump to speak live here at this news conference. Yesterday, we saw one of the longest briefings on record for the president. He took about an hour and 35 minutes talking to the media, and here is the doors opening up. Oh, it's just a fake out. It's one of the other pool photographers there for the White House. But we saw yesterday an hour and 35 minutes roughly for President Trump and the Vice President to really, half of it was statements, and then the other half was all media questions and answer rounds, and some of it really got viral moments out of it, especially when he took on Peter Alexander, an NBC reporter. And now here we go. The door is open, and the president is now in the room. Let's listen live.
Good morning.
Thank you very much. A lot of things going on. We're going to be going over to the Hill, and we're having a lot of meetings. From the financial, this is a medical situation, not a financial situation. The financial, though, is moving along very nicely. I want to thank you for being here and update you on the progress we've made after a week of extraordinary mobilization in our war against the virus. Governors, mayors, the businesses, charities, and citizens are all working with urgency and speed toward one common goal, which is saving American lives. We're in communication with foreign countries. It's now at 148 foreign countries. Can you believe that? 100, you talk about a spread, you talk about a violent spread, 148 countries. Not even believable. There's been a week of national action and of great national solidarity. People are getting along. We're getting along with Republicans and Democrats and independents and liberals and conservatives, and actually it's a very nice thing to see. We're all one beautiful, big American family, and that's taking place right now. Last night, I approved a major disaster declaration for the state of New York. I worked very closely with Governor Cuomo. And this is the first time in our nation's history that a president's used the Stafford Act to declare a major disaster in response to a public health crisis. Never happened before. I'm considering other areas where we may or may not be doing that, and I'm working very closely with Gavin Newsom, Governor of California, and others. We may be doing the same thing depending on their needs, depending on what they're asking for. It's been unprecedented action in New York, and we've had a tremendous federal response all over the country. And I want to thank all the people in the federal government and obviously in the state governments and local governments. We are working hard. Everybody is working hard. And the people standing alongside of me are working very hard. That I can tell you. We've also reached agreements with Canada and Mexico on new travel rules at our northern and southern borders to halt the entry of the Chinese virus while continuing trade and commerce. And we've had very good talks. With Prime Minister Trudeau, and today, this morning, with President Lopez Obrador. And we talked about joint measures that we're taking to prevent the spread of the virus in our countries and to temporarily suspend non-essential travel. We had a great conversation this morning, President of Mexico, and our close cooperation with Mexico and Canada will keep our people healthy, keep their people healthy, keep everybody safe. Yesterday, I had a call with 12,000 small businesses, representatives of these businesses. That's the engine of our country. People don't realize that. You know, you read all about the big ones, but these small businesses, when you add them up together, are really the engine, economic engine of our country. And I assured them that my administration is doing everything within its very considerable power, frankly, to support them and their employees. Nobody's ever done what we've done. Likewise, I had calls during the week with all sorts of representatives and systems like the hospital system. We spoke to many of the hospital systems throughout the country, nurses and doctors, representatives representing hundreds of thousands of nurses and doctors, airlines and cruise ship companies, the Business Roundtable, which was fully attended, and it's all of the top CEOs of our country and beyond, frankly, the businessmen of really, these are world-styled businessmen. These are businessmen that control the biggest companies in the world. Many of them have taken hits, and many of them are just, going forward. Their businesses have been great. Some have been very badly affected. Some haven't been affected at all, and frankly, some are doing very well. They continue to do very well. It's Walmart, as an example, has been really helpful to us. Doug McMillan, head of Walmart, really helpful to us, and I guess I assume they're doing pretty well because people are certainly buying more than even a clip at Christmas by substantial numbers. Pretty amazing, but they're doing incredibly. They put on tremendous extra staff. You don't have empty shelves. A lot of things have happened that are very good. Restaurants, fast food executives, grocery stores, all retailers, literally all of them, in groups. And we spoke with the G7 leaders at length, as you know. You probably know about that. Spoke to many of the governors, spoke to almost all of the governors at conference calls and many of the governors individually. And very importantly, the religious leaders. We had a great conversation yesterday, the Vice President and myself, with the religious leaders of our country, many of the religious leaders, and we've had a number of them during the course of the last 2 weeks, actually. But yesterday we had a very significant call with the religious leaders of our country. I signed legislation providing American workers with paid sick leave and paid family medical leave at no cost to employers, and free testing for those who need it. The testing is going very well, and the Admiral will speak to that along with Tony. We're working quickly to pass additional legislation that will provide massive relief to small businesses and affected industries and give direct payments to our great workers and hardworking American families. There's never been anything like we're doing on the Hill right now. They're negotiating. Mitch McConnell, Chuck Schumer, they're all up there. Kevin McCarthy and Nancy Pelosi. They're all negotiating, and everybody's working hard, and they want to get to a solution that's the right solution. I think we're getting very close. We've also announced that we've moved tax day from April 15th to July 15th, which is a big deal, giving businesses and individuals extra time to file and pay without interest or penalties. So we've moved the date way back, and so it'll be July 15th instead of your traditional April 15th. And very importantly, you will have a lot of time, but you're not going to have interest penalties or any kind of penalties by filing at that later date. HUD announced that foreclosures and evictions are suspended for single-family homeowners with FHA-insured mortgages for the next 60 days. And our great head of HUD, who's with us today, Ben Carson's going to say a few words in a moment. The Department of Education will not enforce standardized testing, which is another big deal, requirements for students in elementary through high school for the current school year. Not fair to do that. So we are waiving that. I I would imagine it's probably the first time ever that's been waived, but I think it's only fair to the students and to the parents of the students. It is also waiving interest and other things that we're discussing right now on federally held student loans, and directed that borrowers be allowed to suspend their student loan payments without penalty for at least 60 days. And we'll be talking about student loans, going to help the students. They're under a great burden right now, so we will be talking about that further, but we're waiving during the 60-day period various elements and very important elements on student loans, big subject. I signed an executive order invoking the Defense Production Act, as you all know, giving us powerful new authorities to help states, cities, and hospitals procure needed supplies. There's been a clear call to action to the private sector, and the call is made right here. It's been really pretty amazing what's happened with the private sector. They are really in sixth gear, I think, which has responded in full force, helping to produce and supply much-needed masks, swabs, sanitizers, ventilators, and everything else. There's a move on that's incredible right now. And by way of example, Hanes, everybody knows Hanes, great company, great consumer cotton products company, is retrofitting its manufacturing capabilities in large sections of their plants to produce masks. And they're in that process right now. And in my direction, the FDA has taken rapid steps to make these items available for medical use right now. I mean, most excitingly to me is what the FDA has done in order to get possibly a very successful number. It's not just one or two, number of therapeutics, medicines that can help people that are already sick, help people not get sick. And obviously, you know about the vaccine, and Tony will discuss that a little bit later, but the vaccine is moving along. But this is something that right now, this is what we really, it's incredible. And what the FDA has done, and Dr. Stephen Hahn, who's highly respected, came as just a highly respected man. He's been fantastic. He's only been here for a couple of months, and he's gotten thrown into the swim of it, and he's really standing up. But the FDA has really moved mountains. I said it this morning. They moved mountains to get approvals on things that maybe work. We'll find out very soon. It won't take long. An example of the Pernod Ricard, which is this is really an example where we're repurposing alcohol. They went out and repurposed their alcohol production capabilities in Arkansas, Kentucky, Texas, and West Virginia to make hand sanitizer. That's a big difference. And they've been unbelievable. They really have. Pernod Ricard. Their first delivery will be on Tuesday. It's going to go to various states. They're going to start, I think, in New York, and they're going to work their way around. They're making a tremendous amount of hand sanitizer at a very high level, too, by the way. We've activated the National Response Coordination Center to level 1. That's your highest level. This is the nerve center of all of our government response to crisis, and it's coordinating very closely with our nation's governors. Our nation's governors, many of you were at the call yesterday with the governors, and I think you can see the relationship, and we've had numerous calls with governors, by the way, but the relationships are pretty amazing. They're loving what we're doing, and the coordination between the federal government and the governors, states, and even local has been pretty incredible. FEMA Administrator Pete Gaynor, who is with us, will soon be providing you with an update on the center's operations, and FEMA's been incredible. We got them involved last week, very much involved, and now they're involved nationwide. We've dramatically expanded telehealth so Americans can see a doctor without leaving home, something which more and more people are using, and now they're really using it, and now the ones that are using it are loving it. And I think we're going to change the way our country functions medically and probably in other ways because of what's going on right now. This will reduce the chance of infection and preserve hospital capacity, so it solves a lot of problems. Every American has a role to play in defending our nation. from this invisible, horrible enemy. It really is. It's an invisible enemy. And we will be successful, very successful, hopefully very much sooner than people would even think. So we say stay at home and save lives. There's a time of shared national sacrifice, but it's also a time to treasure our loved ones and to take stock of what is most important, our faith, our families, our neighbors, and our great country. And I want to thank all of the incredible people of our country, the citizens of our country, that what you've done and the way you're responding has just been very special, something that we will never forget, that the history books will never forget. And we're going to have a great victory. We're going to be celebrating a great victory in the not-too-distant future. And I just want to thank everybody. And now I'll introduce our Vice President, Mike Pence, who's led the task force. And I will tell you this, he has not slept much, maybe a tiny bit, maybe a little bit, but not much. And he's done an incredible job. Mike, thank you. Please.
Good afternoon, all. And thank you, Mr. President. The White House Coronavirus Task Force met today. We briefed the President on our latest recommendations. We continue at the President's direction to lead not a whole-of-government approach, but a whole-of-America approach. You just heard the President describe one inspiring story after another, the way the American people are responding, the way American businesses are responding, religious communities across this country. The American people are coming together. They're responding with common sense, compassion, and generosity. People are heeding the advice of state and local authorities, and tens of millions of Americans are putting into practice 15 days to slow the spread. We are officially, Mr. President, 6 days into our 15 days. And as we look all across this country, while we strongly support the decisions that governors in states where we have significant outbreak have taken, we encourage every American to listen to those state and local authorities. For every American, this is what you can do to make a difference over the next week and a few days to protect your health, protect your family's health, but most especially slow the spread and the potential for the coronavirus to impact the most vulnerable. As the President said, we've almost been overwhelmed at the outpouring of support from American businesses. The President spoke yesterday to thousands of small businesses. We spoke to manufacturers yesterday. And in fact, as the President indicated, the FDA in record time just approved one manufacturer that will be producing millions of surgical masks in a matter of weeks for the American people. The pastors we spoke to, we want to thank all the religious leaders from every community of faith in the country, making the hard choice to suspend services, to have online services, even while those ministries are continuing to support food banks and come alongside the most vulnerable. And of course, the chorus of prayers that is coming up from communities of faith around the country is making the difference that it always has in the life of this nation. One thing the President and I promised was to remind people that on the weekends that you're not in the pews, it's still a good idea to, if you can, to go ahead and make that donation, because all the ministries are continuing to play a vital role in our communities, and we encourage your continued support. The President and I are grateful that the American people are listening to state and local authorities and putting into practice all of the recommendations in the President's coronavirus guidelines. As you will hear in just a few moments from Admiral Gua, testing is expanding rapidly across the United States of America. State-run drive-thrus are expanding across the country. And as you will hear detailed this morning, now more than 195,000 Americans and more who have been symptomatic have been tested. That number does not include county hospitals or or healthcare labs around the nation, some 15,000 in number. And among the number of the more than 195,000 that have been tested, it's important to remember that only 19,343 at this moment have tested positive for the coronavirus. We continue to urge state and local health authorities to contact FEMA for all the latest developments and innovations in testing. But we want to remind Americans, as Dr. Fauci will emphasize in a moment, if you don't have symptoms, don't do a test. It is another way that the American people can make sure that we are preserving the resources that our healthcare workers need to minister and to support those who are dealing with the coronavirus and other illnesses. In a moment, Pete Gaynor will detail the efforts at FEMA. Since the President's national emergency declaration, we have FEMA in the lead, stood up the National Response Coordination Center, as the President said, and we are working closely, literally hour by hour, through FEMA, processing requests from states most impacted, like New York, Washington State, and California, and we'll continue to work very, very closely with those states through the very traditional means of federal emergency management at FEMA. Secretary Carson will describe decisive actions the President alluded to bring foreclosure relief to Americans. And on the subject of supplies, in a moment you will hear of not only the progress that we're making on testing, but on Monday we'll be detailing for the American people the progress that we are making on the President's strategy of procuring more personal protective equipment and medical supplies, allocating them through the system of FEMA, and continuing to urge conservation by Americans. In fact, I'm pleased to report to the President today that HHS just placed an order for hundreds of millions of N95 masks that will be being made available to healthcare providers across the country. On behalf of the President, we do renew our call for Americans to postpone elective medical procedures, including dental services. And remember, this is another way that you're going to make sure that medical supplies are available, because by postponing elective medical procedures, you're freeing up medical supplies for those dealing with the coronavirus. As the President mentioned, our team is on Capitol Hill as we speak, working with members of Congress in both political parties. They're making progress, by all accounts, on a bipartisan bill. They worked late into the night last night, started early this morning, and we are working to pass that legislation on Monday in both the House and the Senate. Now, on a personal note, many of you may have been made aware that a member of my staff has tested positive for the coronavirus. We learned of that late yesterday. I am pleased to report that he is doing well. He had mild cold-like symptoms for about a day and a half, has not been to the White House since Monday. Neither the President nor I had direct contact with that staff person. We worked immediately with the White House physician and the CDC. We've done all contact tracing. And while the White House doctor has indicated that he has no reason to believe that I was exposed and no need to be tested, given the unique position that I have as Vice President and as the leader of the White House Coronavirus Task Force, both I and my wife will be tested for the coronavirus later this afternoon. Let me say again how grateful the President and I are that every American has acted on the President's coronavirus guidelines. We are 6 days into 15 days that, as Dr. Fauci may well reflect in a moment, is an opportunity for us here on the footholds of this epidemic curve in our country to literally lower the impact in our nation and save lives. Every American can do their part to slow the spread, and we encourage you each to continue to do that. As the President says often, remember, we're all in this together. And also remember that for most Americans, the risk of serious illness from the coronavirus remains low. The reason we want to put into practice the President's coronavirus guidelines is because no American would want to inadvertently expose someone who is vulnerable, a senior with a serious underlying health condition, to the coronavirus with a potential threat. I did hear one story this morning, Mr. President, about a senior named Geneva Wood. She actually is at the Life Care Center in Kirkland, Washington. She is not only a grandmother, she is a great-great-grandmother. 90 years young, and she tested positive for the coronavirus on March 6th. But by all accounts, she's doing well. She wanted America to know there is hope, and her strength and her enthusiasm is truly an inspiration to the nation. As the President said many times, we're going to get through this and come out stronger than ever before. And we'll get through this as Americans together. Thank you, Mr. President.
Thank you very much. Thank you, Mike. Admiral, please.
Thank you, Mr. President, Mr. Vice President. As I told you earlier last week, we are in the process and are effectively transitioning to large-scale testing by leveraging all the components of the American healthcare system. When we started, it was CDC only. Then it was the state public health laboratories. Now we're transitioning into the mainstream of American testing with many of the companies that the President invited in the Rose Garden just a week ago. So currently, 91 public health laboratories, state public health laboratories, are up and running in 50 states, the District of Columbia, Guam, and Puerto Rico. This is our curve, and I want to be very clear about this, that this only accounts for CDC, state public health laboratories, and the laboratories that are members of the American Clinical Laboratory Association. These are the main reference laboratories: LabCorp, Quest, Mayo, ARUP, BioReference Labs, and Sonic Healthcare. It does not account for the well over 10,000, 15,000 hospital-based labs, many of which are doing testing, for whom we will get data this week to give you an overall roll-up. As you can see, over 195,000 people in America have completed their testing. That means tests plus results. This does not count the people whose tests are in process. And as you see, this curve is going, it will continue to rise dramatically over the next period of time. So again, this is utilizing all the components of the great American healthcare system, the state and local public health laboratories, the hospital system, which is not represented here, and the main reference laboratories. Now, I do want to make it clear that although testing is becoming more available, and Dr. Fauci will definitely emphasize this more, there are priorities for testing. And clearly, everyone across the country should understand that those hospitalized or in an ICU are a priority for testing. Symptomatic healthcare workers, for obvious reasons, we want to make sure that their health is preserved and that they are not going to spread to those who may be seriously ill. Symptomatic people in long-term care facilities. As the Vice President has highlighted, and we've said many times, elderly in our society have a much higher mortality rate, much higher serious complication rate. Symptomatic individuals over 65, symptomatic individuals who have underlying conditions like chronic heart disease or liver disease or other types of chronic diseases. Patients in public health investigations, and there are local priorities around the country, particularly healthcare workers for testing. And Dr. Fauci is going to emphasize this about the types of people who may not be to be tested. Testing is going well, it's ramping up, but we should still have priorities. Finally, I want to talk about the community-based testing sites. I know they're popular now because there's now an acronym, which I'm sure the Vice President doesn't appreciate, CBTS, or CBT sites. We talked about these earlier in the week, and I wanted to emphasize again that these are state-managed and locally executed. The federal government is there to provide support, know-how, blueprints on how to do this, but these are really springing up at dozens and dozens of sites all over the country, adapted to the local needs. Some are drive-through, some are walk-up, some are geared to healthcare workers and emergency responders. So again, what we see in the upcoming week is this curve will continue to increase as testing becomes more widely available, as the great American healthcare industry continues to increase the availability of tests and the throughput of those tests. Thank you, sir.
Thank you very much, Admiral. Dr. Fauci, please.
Thank you very much, Mr. President, Mr. Vice President. What I want to do just over the next minute or so is maybe connect some of the dots of the things that you've heard today. First, the status of the dynamics of the outbreak. I mean, you all know the numbers. You've seen them. We have widespread infection, but to varying degrees throughout the country. So, for example, when you talk about the kinds of mitigation issues that we have put forth and have emphasized, just as I mentioned the other day, there are two dynamic forces that are going on at the same time. You're having the natural course of an outbreak trying to peak at a high level, and then you have the mitigation strategies which are aimed at dampening that. We've mentioned that multiple times. We often get asked, how do you know you're having an effect? Because there are two things that are going on at the same time. They may be confounding. Well, I can tell you for sure, from a public health standpoint and experience with other outbreaks, we know we are clearly having an effect, but we can't quantitate it for you accurately now, because looking forward, you'll know what the impact of the rate of these steep inclines will be. So that's why we're going to come back to you every day and keep you up to date about that. Getting with regard to the disproportionate of the response, everyone, it's right here, I'll open up the Vice President's book with his permission. This is baseline for everyone. In other words, throughout the country. But then there will be areas, and you've heard them, Washington State, California, New York City, in which the dynamics of the outbreak are clearly different and much more robust, if you want to use that word. And that's the reason why we've seen the mitigation ratcheted up in that regard. And again, hopefully, and I have confidence it will happen, you will see an impact on that. Next, getting to testing. You saw the numbers with testing. Remember, there was always an issue with testing. I think we're getting to the solution that everybody in the country is looking for. But I want to emphasize one thing that Admiral Giroir mentioned, is that not every single person in the United States needs to get tested. He gave you the priorities. I don't want to repeat them. But let me tell you one of the unintended consequences of individuals who don't need to get tested that flood the desire to get tested. Currently, and I hope we'll be able to change it and make it much less reliable on PPEs, when you go in and get tested, you are consuming personal protective equipment, masks and gowns. Those are high priority for the healthcare workers who are taking care of people who have coronavirus disease. So what we don't want to do is to have a situation where we do have disparities in availability of PPEs now, and we're working hard to correct that. But currently today, we want to make sure that the people who are taking care of people with coronavirus disease do not endanger themselves because they don't have the personal protective equipment. And then finally, one last thing was just mentioned. The Surgeon General has been pushing this. Please put off, cancel elective medical and surgical procedures. You don't want to not ever do them, but for the time being, don't do them, because they also not only consume personal protective equipment, they may also consume some of the things like ventilators that you might need. So let's pull in this together, and we will get through it. I promise you. Thank you.
Thank you, Tony, very much.
Thank you, Mr. President, Mr. Vice President. FEMA is now leading the federal operation or the federal response for all operations on behalf of the White House Coronavirus Task Force, who oversees this whole-of-nation response. HHS will continue to provide their matter expertise on health, and pursuant to the nationwide emergency declaration, FEMA, in coordination with HHS, is assisting state, local, tribal, territorial governments and their other eligible entities with health and safety emergency protective measures on behalf of the American public. As of yesterday, 50 states, the District of Columbia, 5 territories, and 1 tribe are working directly with FEMA under the nationwide emergency declaration for COVID-19. In just 24 hours, we've obligated $100 million to states, territories, and tribes. A little bit about supplies. It is of the utmost importance that requests for assistance, especially for critical supplies, get routed through proper channels as soon as possible. And we ask everyone to follow the normal procedures FEMA uses in a natural disaster. There's no different procedure for the COVID-19 pandemic. But remember, you can still order supplies from your regular vendors and buy it on the open market. Buy it where you can find it. We will reimburse you. If you buy medical supplies from foreign sources, it is reimbursable. Buy America does not apply to the Stafford Act, except for Washington, D.C. and Puerto Rico. If you can't buy it on the open market, make a request through the FEMA system. Requests for assistance at the local and county level should first go to states,
from states to the regional FEMA offices, and then from those offices right here in D.C., where the National Response Coordination Center is open and running. We are getting requests for masks, PPE, swab sets, test site supports, ventilators, hospital capacity assessments, and many more. We are in lockstep with HHS to answer these requests, but we will do whatever is necessary to get states, tribes, territories, and others what they need. And then finally, what we are doing here in Washington, D.C., again, this is a whole-of-government response. Like all emergencies, response is most successful when it is locally executed, state-managed, and federally supported. We can't say that enough. On Thursday, our federal partners fully integrated with our National Response Coordination Center, and additionally, all 10 FEMA regions across the country have been activated. The FEMA regional administrators will continue to coordinate closely with governors, state emergency managers, state public health officials to determine the type and level of support needed to respond to this dynamic threat. Thank you, sir.
Thank you very much, Pete. Appreciate it.
Ben.
Ben, please.
Well, thank you, Mr. President and Mr. Vice President, for your tireless leadership here. And I also want to thank the fellow task force members who have been working around the clock in a very patriotic way to serve their fellow Americans. You know, part of the American dream is having a home. And sometimes people say, well, what does housing have to do with health? It has everything to do with health, having a safe home. And that is the reason that the President has authorized the immediate cessation of foreclosure and eviction proceedings for American citizens, single-family forward mortgages, as well as reverse mortgages. And as you know, FHFA has also decided to do the same thing for 60 days. And the CFPB is very happy with all of this as well. And it's really all about helping our people, recognizing that they're being severely impacted by the coronavirus. And we've also asked the various servicers of mortgage loans to exercise forbearance for anybody who's having difficulty. It is important, if you're having difficulty, to actually contact the people who have made the loan, who established the mortgage, because it doesn't happen automatically. What does happen automatically is that we cover all 8.5 million people in terms of the moratorium on foreclosures and evictions. We want also for the PHAs to be protected. HUD does not have authority to mandate that evictions can occur, but we are in contact with all the PHAs across the country and are petitioning Congress for the power to be able to actually enforce that. But the fact of the matter is most of the PHAs are run by people who actually care about other people. So we really haven't seen much of a problem there. We haven't seen much of a problem with forbearance and needing to try to force people to do it because they want to do it. People are stepping up and saying, what can we do to be helpful? As far as housing choice vouchers, Section 8 is concerned, the April vouchers will be sent out next week. May vouchers are already being worked on. And we're also staying in contact with all the stakeholders, the advocates for low-income housing, as well as other stakeholders to make sure that we're doing things that are most helpful to them. And additionally, we've extended the deadlines for healthcare and multifamily financial reporting requirements. And that's for over 20,000 multifamily and healthcare borrowers until April the 30th. And that provides them with a lot more flexibility to deal with the issues that they're dealing with. I also want to thank our FHA Commissioner Bryant Montgomery, as well as the FHFA Director Mark Calabria, and Kathy Kraninger, the Director of CFPB, who've all worked tirelessly with us to make this happen. What we're trying to do is bridge the gap, recognizing that it's a lot easier for us to take these measures and for Congress to take the measures that they're taking so that we don't destroy a very excellent system and have to start all over again. So for those who are worried about the money that's being spent, if you don't spend the money and deal with this now, it's going to cost a whole lot more to try to build all this up again. And as was mentioned by the president, there's been a sense of unity that we haven't seen for a long time in this country. And let's hope and pray that that unity lasts far beyond this crisis.
Okay. Ben, thank you very much. A few questions, please.
Mr. President, a few questions, if you don't mind, sir. If you've lost your job now, or you're worried that you're going to lose your job tomorrow, restaurant, something like that, what do you want people to do immediately? The second question, sir, you heard from the Vice President that he's going to be tested. Have you taken a test since last Saturday? I know you told us.
I just took one.
You just took one. How are you feeling?
I feel great.
Okay.
I
guess
I hope I look good.
You've taken more than one.
Those people are going to be...
Sorry, hold on one second. Yeah. So, okay, so for those people that have lost their job already, or they're worried that they're about to lose it tomorrow, what do you want them to do right now?
Well, what they do right now is keep receiving their paycheck, and hopefully their companies are going to be in a very strong position. We want to keep everything together because we think we're going to have a tremendous bounce back. Now, some people agree with that very strongly. Some of our top economists, they think we're going to have a once we solve the problem that we're working on, the medical problem. So we want them to keep their jobs, stay where you are, and we'll see what happens. Now, if they don't, we have unemployment, we have checks, we have a lot of things happening, a lot of very positive things. Nobody has ever done. Now, this is working with Democrats, this is Republicans and Democrats and myself working together. Nobody's ever done a package like this. It's a great package, but ideally we want them to be able to keep their jobs, keep the pay coming, and I think that's going to happen. Kelly, go ahead.
Mr. President, on your Defense Production Act power, one of the features of that is that the federal government would be able to control the output, whether it's masks or ventilators, get it to the most areas of need, and control the pricing to keep it at a market level so it's not price gouging. One of the things we're hearing from governors, they can't find supplies and prices have gone up. So you've talked about the act, sir, but you have not yet compelled any companies. Why not?
Because we have so many companies making so many products, every product that you mentioned, plus ventilators and everything else. We have car companies without having to use the act. If we don't have to use specifically, we have the act to use in case we need it. But we have so many things being made right now by so many, they've just stepped up. In fact, Mike Pence and I were discussing it before. We've never seen anything like it, where they are volunteering. We want to make masks, like Hanes. I brought that up as an example. General Motors, I bring that up as another.
They go on the
Ford.
open market, sir, right?
They're going to go on the open market. We want them on the open market from the standpoint of pricing, because otherwise it's going to be, we could be very unfairly treated.
Direct them to the places in greatest need.
We are directing states, and sometimes we'll be competing against states, which I don't want, and we'll drop out of the bidding. We want the states to go first. And you know what we're doing is we're helping states. That's what we want to do. Same thing with the testing. We're helping states. We're helping states get to where they want. And we've made tremendous progress in every aspect of it.
This happens for a governor who needs equipment today.
Well, it's happening fast right now, and the governors are out there trying to get, and if they are competing with us, we immediately drop out. Please.
Mr. President, forgive me if I heard you wrong at the beginning, but you said something, we are going to be going over to the Hill. Are you going yourself?
My people are, and I'll be staying here. I'll be in the Oval Office and various other places in the White House.
And on that matter, you're asking Congress to essentially pass a series of legislation that's going to amount to about $2 trillion, 10% of the GDP. What do you say to members in both parties who say this is too expensive, this is just too much to debate and get done in 48 hours or so? And also, have you spoken directly with Speaker Pelosi at all about any of this?
Okay, so I've spoken with, I'm not going to say who I speak with, but I've spoken with directly or indirectly everybody many, many times. We're doing very well. I think the Democrats and the Republicans are going to come up with a package that's going to be really something very special. It's going to help people. This is the first time there's ever been a case where you want people not to work. It's always, you want to create incentive to work. We're creating not an incentive not to work, but the fact is we're asking people not to work because of they have to stay away from each other. If we're going to kill this horrible hidden enemy, we have to stay away. So there's never been a thing like this in the history of the world. And other nations are doing similar things, some effectively, some not effectively. They're doing similar things. We are creating a package that's going to keep companies together, keep workers paid so they can live and sustain. We'll see what the timing is. The biggest thing we can do is get rid of the problem. The problem is exactly what we know, the medical problem. We want to have this whole incredible situation that it can start right away. Not that all these companies break up, all the workers are out of jobs, you can't put them back together, and it would take years to put them back together. Because we had the greatest economy in the history of the world until we got hit by this problem. And we can be back very, very quickly. And it's our intention to be back very, very quickly. So we're doing a package, the likes of which nobody's ever done before. I'm obviously the one that has to approve the different things and the recommendations of the different things. And like buybacks as an example, and stock buybacks, I didn't like it the first time, and this time I'm saying, you're not doing it. I don't want money to be used for that. I want money to be used for workers and for opening businesses, keeping businesses, not buybacks. And well, I am strongly recommending a buyback exclusion. You cannot buy back your stock. You can't take $1 billion of the money and just buy back your stock and increase the value. Please.
On the subject of masks, the Vice President announced HHS was ordering hundreds of millions of them. Was that order just placed today? How is that going to be distributed, and when can doctors and nurses expect to actually receive those masks?
Yeah, HHS is completing a $500 million order of N95 masks, and all of this is being coordinated through FEMA, and we are responding specifically to state requests where the needs arrive. As Dr. Fauci said, we want to make sure the people that are providing healthcare services to people who may have contracted coronavirus have the protection to keep themselves and their families healthy. But I want to emphasize the supply of so-called N95 masks has been vastly increased in the country because the president insisted that we extend liability protection to industrial masks. What all the experts told us early on was that industrial masks that are used on construction sites, the president's very familiar with from his past life, are perfectly appropriate to protect healthcare workers from respiratory illness. But they didn't have the liability protection because they weren't created for hospitals. We worked with leaders in both parties. We added that protection that runs through 2024, that now the industrial N95 masks can be purchased by hospitals, purchased by states, purchased by HHS, and distributed through our system. So we're making those available. The supply has been, as I said, vastly increased, and it was another step forward and a bipartisan accomplishment. And we're continuing to use all the kind of creative means of American industry to make sure that we're leaning into this effort and that we do whatever it takes to make sure that our healthcare providers have the protective equipment.
We are still hearing from doctors and nurses about this shortage. When exactly can they expect to receive these masks, though?
Well, let me let Pete Gaynor speak to that, because FEMA will be, HHS is now fully integrated into FEMA, and so as the requests come in, but obviously, as I'm sure the administrator will say, they're being prioritized to those areas with the highest need. Yes, sir. Pete?
So within the National Coordination Center, we have a supply chain task force. And in basic sense, we're trying to identify the universe of what's out there. So whether we hold it at the federal level, we hold it in the private sector, and then match that up with demand and asking people to be creative. We're asking, again, this is a shared responsibility. We're asking locals and states to do your share locally, try to take a little bit of burden off of us, and then we'll prioritize those scarce resources, because every single governor across the country is looking for the exact same thing. So there's a balance, but we're examining the entire supply chain to make sure that we make
the masks start coming in.
They're out there now. So again, we want to match. We want to get out of the middle, I think.
I appreciate it. Yeah, that's what I like to know.
So we're trying to match suppliers with demand. So that's what we're doing right now. It's happening today.
They can expect them to do, or they're matching supply and demand.
There's a range of requests across the country, and we're trying to match those, again, supply and demand every day through the task force.
We have a lot have already come in. I have to tell you, the throwing away of the mask, being in private business, They're throwing away the mask right away. They're throwing away, and when you hear 55 million masks were ordered, I'm saying 55 million. How could it possibly be such a number? And they say, oh, that's just a small fraction of what we need. And I said, why aren't we sanitizing masks? You know, you look at the masks. I've looked at all the different masks. Some don't lend themselves to doing that, I think, but many do. And I said, why aren't we have very good liquids for doing this, sanitizing the masks. And that's something they're starting to do more and more. They're sanitizing the masks. And I don't know if anybody would like to speak to that.
We issued
You might want to discuss.
Yeah, there are some CDC guidances about how you can minimize the use of masks by different things that you could do with testing, and when you have masks, how you might reuse them, which ones you can reuse them.
Do you think there's a solution to this other than buying more masks? Do healthcare providers need to change how they're using them?
Yeah, well, there are a couple of things. One, for example, we are moving towards getting testing where you don't have to have PPE. I mean, I'm not going to tell you the day it's going to be there, but it's going to be a swab that you could stick in the nose of the person who is either infected or not, but that person doesn't need PPE, the person who's administering the test. So if you could do a self-administered test, stick it in a vial, hand it over. You don't need a mask, you don't need PPE. That's one of the things we're trying to do.
I would have liked that much better. Personally, yeah, go ahead.
May I? And this is another story about great American industry. The president and I literally heard directly from Apple that they're donating 2 million industrial masks to this effort around the country, and,
Yes.
working with our administration to distribute those. And it might be a good opportunity for us to renew our call as the president and I delivered this message to businesses yesterday, manufacturers and small businesses. It's a great time to go to your storeroom, and if you have N95 masks, if you've got 100 of them, if you've got 10,000 of them, is to load them up, drive them over to your local hospital. That story is literally happening all over the country. And now with more Americans stepping away from elective surgery, including elective dental care, we're urging dentists around America to look at their supplies of N95 masks and make those available to our hospitals. But the great news is, as the president said, the American people are all doing this now. So allow me to say on behalf of the president, thank you for what you all are doing today, but we want to encourage people in business, encourage people in dentistry in particular. Look at those supplies of N95 masks. Pack up as many as you can spare. Drop them off at your local hospital. It'll be a great service to the country.
Mr. President, I just want to read you some of what some of the doctors on the front lines of this crisis are saying.
You mean the ones that are saying good things or bad things?
These are doctors who are talking about the shortage of medical supplies that they are facing. Dr. Faiza Bucks in Kentucky says there's absolutely no way to protect myself. A surgeon in Fresno, California says we are at war with no ammo. Dr. Mel in Illinois says if this is a wartime situation, then now is the time to act. I know you're talking now about increasing production at so many of these facilities to get the masks out, but given that this is one of the wealthiest, most powerful countries in the world, should this even be happening? Shouldn't this have been resolved weeks ago?
I'll tell you the way I look at it. So many administrations preceded me. For the most part, they did very little in terms of what you're talking about. This is unprecedented. You could speak to Tony, you could speak to anybody. This is unprecedented or just about unprecedented. As time goes by, we're seeing it's really at a level that nobody would have believed, nobody would have thought possible that this could happen. And we are making much of this stuff now, and much of it's being delivered now. We've also gotten tremendous reviews from a lot of people that can't believe how fast it's coming. I mean, when I hear they have an order of 55 million masks, and that's just one order, that's one order out of many, and that there are many millions of masks beyond that that are, and I keep saying, how is it possible to use so much? But that's the way it is. And part of that is because they'll use a mask for a short period of time and they throw it. The fact is that we are doing a tremendous amount. We started with very few masks. We had some, but nothing for an event like this. And now we're making tens of millions of masks and other things. And I think it's unprecedented what we've done and what we're doing. And many doctors, and I've read many, many doctors, they can't believe the great job that we've done. Yes.
It has been many.
Kelly, did
Mr.
you have
President,
one?
it's been nearly 3 months since your administration
Sorry.
learned about this virus.
Well, if you remember, I was the
Why
one
not
that
sooner?
I was the one that closed the country down. I was the one that closed the. You don't write that, or you don't say it too much, certainly on CNN. But I just read an article yesterday. That by closing the country down so early, very early, we saved tens of thousands and much more than that lives. So. You might want to report that too. Go ahead, Chris.
I'd just like to address that for a moment. Again, I'm an ICU physician, ran health systems, and I, first of all, want to thank everyone who's on the front line in the emergency room, in the ICUs, in the hospitals. I speak to my colleagues daily. We need to preserve our PPE to the degree that we can. CDC guidelines has had that. The president has talked about it. But I also want to say we are making product, as the president said, but we are also responding through the FEMA system to distribute the strategic national stockpile resources according to requests that come in. Stockpile has been distributed to many states, first orders, second orders, and on a daily basis adjudicating that. If there are shortages in your hospital system, I can't tell you of Dr. X, Y, Z, that needs to be clearly iterated to the local emergency management.
Are you seeing those hospitals talking about the shortages?
We were on the
asking federal
phone 2
government?
nights ago or 3 nights ago with over 2,000 hospitals or hospital systems sharing best practices from Seattle, where they've been very innovative, pioneering some of these areas. When there is a shortage, they need to go through their emergency management. It goes directly up to the FEMA system, which really rocks. It really works very, very well. And then there's a distribution of the stockpile. Now, the stockpile isn't infinite. That's why it's being replaced by all the orders. But mask supplies go out on a daily basis as they are needed and requested through the FEMA system. And I don't know, Administrator Gaynor, whether you want to add to that.
Tony, would you like to say something about that?
Just to reiterate what Brett said, we don't take lightly what you just read. I get the calls every night, the way you get emails. It's a serious issue. We don't want that to happen, but it is happening. You're not making things up. I know that because I'm experiencing myself. But what you just heard about the different avenues, some of which aren't even recognized, about how you can get help through the FEMA process, in addition to the large amounts of additional PPE that's coming into the system. We hope that very, very, very soon, we're not going to get those kinds of real-life difficulties.
Matter of weeks? Again, it seems like there's a question about the timeline here, and even FEMA can't quite answer what the timeline is. Days, weeks.
Yeah, sooner than weeks. It's going to be days, I would hope. We're going to try to make it days to the best possible way we can.
And again, what we're doing is we're trying to help the states get things faster. And that's what we're doing. We're implementing. And the magnitude of this, it's a tragedy. It's an absolute tragedy. But the magnitude is something that no matter who you were, no matter where you come from, nobody ever thought a thing like this could happen. You read about 1917 and you read about certain things, but you think in a modern age a thing like that could never happen. Well, it comes back. It is genius. It comes back, and it's too bad. But I think the people working on this have been incredible. The job they've done has really been incredible. But there's tremendous amounts of not only masks, of ventilators and respirators and everything you can think of. It's all being, much of it, and almost, I could say all of it is being manufactured right now. Steve, please.
Yesterday, there were questions about the use of this malaria drug. Have those questions now been resolved?
Well, I don't know that resolved. I could say that it's going to be distributed. I know New York is getting, I think, 10,000 units, and numerous other people. It's really, it could be the malaria drug plus the Z-Pack. But, and we're going to find out. We're going to find out. I feel, look, I feel, as the expression goes, what do we have to lose? Because, I feel very good about it. Tony would feel, like he'd like samples done in a certain way, and I understand that too. Many doctors agree with that. We don't have much time. We have a lot of very sick people right now in hospitals all over the place. And speaking with the governor, New York, Cuomo, I said, how's it look? He's got a lot of sick people. So we're going to be delivering a lot of samples to New York and other places, and we're going to find out very shortly whether or not it's going to work. I feel very confident. I mean, I've seen things that surprise me, frankly. There are, as Tony said, there are other things we're looking at, too. Vaccine, of course, is incredible, but this is more immediate. Right now, this, to me, would be the greatest thing that could happen. This would be a gift from heaven. This would be a gift from God if it works. So we're going to pray to God that it does work. It'll be a fantastic thing.
Mr. President.
Yeah, please, Rebecca.
Mr. President, on the economic front, there are reports that the coronavirus is really hurting your businesses, especially your hotels.
My businesses?
Yeah,
Sure.
so is that true, and can you speak
Well,
to
I wouldn't say it's
financials?
thriving when you decide to close down your hotels and your businesses. No, I would say, but I'm very underlevered and everything, so that's good. But is it hurting yeah, it's hurting me, and it's hurting Hilton, and it's hurting all of the great hotel chains all over the world. It's hurting everybody. I mean, there are very few businesses that are doing well. Now, there are some that are, like, as an example, the Walmarts of the world, because everybody's lined up to get things and stock up their house and this and that. But sure, it hurts my business. But
And did you or anyone in your administration talk to anyone at the Trump Organization about the potential effects of the coronavirus?
no, I didn't speak to anybody. I speak to my sons, but I talk about the coronavirus, but not as it pertains to my business. They basically follow the rules. When they say close them down in New York, we close them down, or wherever they may be. I actually have them all over the world.
Will you no longer
And
go
when
to
they say close them down, we close them down. What, Kelly?
Will you no longer go to Mar-a-Lago or Bend-Stuy?
Well, I have nothing planned at Mar-a-Lago, but right now I think Mar-a-Lago, I guess, I haven't even asked, but I imagine that's closed down just like a lot of other businesses in Florida, right? Go ahead.
Do you expect your family company to seek government assistance if it's eligible?
I don't know. I mean, I just don't know what the government assistance would be for what I have. I have hotels. Everybody knew I had hotels when I got elected. They knew I was a successful person when I got elected, so it's one of those things. I guess I get paid $450,000 a year. I give it up. I put it back into the nation. I have to, by the way, you have to designate where you want it, so I oftentimes give it to opioid, research and things.
Specifically, not you.
But as far as the hotels and everything, I mean, I have to do what everyone else is doing. I would probably decide to close things up. I think it's a good thing. You don't want people getting together. And hotels and clubs and everything, you get together. We want to beat this deal. So I have many of them, hotels, clubs, things like that, where people get together. I would think it would be a good practice to close them up. Yeah, go ahead, please.
Mr. President, as you know, we've been talking a lot about masks. We've also talked about how not everyone needs to take a test. What about a temperature test? As we know, we all came into this room and got tested before we entered.
Well, I do it.
the grounds.
I have temperature tests, and I didn't ask everybody here, but I wouldn't be surprised if they had temperature tests.
Should those thermometers
Otherwise, I'm going to run off the
sensors
stage.
be distributed? Should they be on a mass distribution basis too?
Oh, I think they are pretty much. The easiest thing is the temperature. I think they are. I don't know. Are you learning a lot from the temperature test, Tony? Could you maybe discuss that for a second?
Yeah, I mean, they have a place. They're not infallible. I mean, there's so many ways to get around that. I mean, right now, every time, certainly here, every time I go into a different room, I get my temperature taken. But we see that on the outside, that some people are doing that.
I took his temperature twice, actually.
It was very low. There is a role for it under certain circumstances. What I don't see is a massive distribution of thermometers that are going to actually have a major impact on what I showed, what we need to do.
And I've seen things when Tony mentions thermometers. They aim something at your forehead, they stay this far away, boom, and they tell you what your temperature is. I said, I've never seen that before. I've learned a lot. It's incredible. Go ahead, the back corner.
Kelly Greeno with OAN, thank you. This morning, the Washington Post ran a story suggesting that you delayed taking action on the virus in January and February. Dr. Fauci has indicated that your action in the Chinese travel ban helped America immensely. What do you say to the Washington Post?
Well, I love whoever you're with. That's because I think that's such a nice question. No, I think the Washington Post covers us very inaccurately, covers me very inaccurately. I saw the story. I think it's a disgrace. but it's the Washington Post, and I guess we have to live with it. It's a very inaccurate, quiet. It's a very inaccurate story. From many people, I get a lot of credit for having closed our country very early to a very heavily infected country. China, unfortunately, China. I wish China would have told us more about what was going on in China long prior to us reading about it, even though the news isn't exactly disseminated. As you know, China kicked the Washington Post out of China, and they kicked the New York Times out of China, and I guess the Wall Street Journal. That's okay. I mean, that's what they do, and I think it's a terrible thing they did. But I also think it's terrible when people write inaccurately about you, and they write inaccurately about me every single day, every single hour. And by the way, your group really, I really think, and I just say fair, not good or bad. I think you write very fairly and do very fair reports about the great job that all of us are doing, that this group behind me is doing. It's so insulting when they write phony stories that they know are fake news, because they're not insulting me, they're insulting everybody, these incredible people that have worked so hard, so long, that are thinking about nothing other than this invisible enemy. They have done such an incredible job, and they will continue, and we're going to win, and there'll be a lot of celebration when we win. And we're going to win with as few lives lost as possible. That's the game. Win with as few lives lost as possible. It's a tough enemy. It's a tough killer. Far bigger, far more vicious than ever before. But I appreciate you saying it, because the fact that we closed so early to China, and most people, hey, look, I was called xenophobic by Sleepy Joe Biden. I was called a racist by Democrats, a racist. I was a racist because I decided that I didn't want to have people that could hurt our country come in. And I was pretty much in a very small group of people, I will tell you. It was a tiny little group. Most people, even that worked in the White House, disagreed with me very strongly. Saving of those many weeks was a tremendous thing. And when they keep talking about acting early, that was the ultimate act. That was the biggest act, because we didn't. And then I also closed Europe early, very early. And I took a lot of heat for that, too. But that was a good thing. Now they're doing similar things that we're doing. So I didn't act late. I acted early. I acted far before anybody thought I should be. I took tremendous criticism from the various papers, from many of the papers. So I very much appreciate the question. It might have been more of a statement than a question, but whatever it may have been, I appreciate it very much.
Mr. President, about this, so a number of the states have kind of done these different measures. We've seen California order one thing, New York, just be similar. Do you want all of the states to do one uniform?
No, they can do what they want to do. If California can get a mask sooner than we can get it for them, through all of the things we're able to do, but we're going to end up with a big oversupply at some point. At some point, this is going away, and we're going to end up with a big oversupply. And you know what? In this case, that's going to be okay. But if Gavin can go out and order gowns faster, or masks, good masks faster, or other things faster, that's good. We do have a lot of, the coordination with the ships that we're sending in, as you know, the medical ships that we're sending in, and even cruise liners. We're going to be sending in probably cruise liners into some areas, in particular California and in particular New York. But if somebody can do something faster, if they can order that mask faster than us, I want them to be able to do it.
Sorry about the rules, sir. So people can't leave their homes. That certain businesses.
We coordinate very much with them. Yes.
You don't want all of those to be the same.
Well, it doesn't have to be at this moment, because we have places in the country where, states where they have 2 people or 3 people, and those people are in quarantine, and you can't put on them what you're putting in New York, where you do have a tremendous problem. Yeah. We have large portions of the country, Middle America, where, they have a few people. So it may be a time, I hope that never happens, where we need to take very drastic action. But right now, that's not in the same ballpark. Yeah, go ahead, please.
We're at day 6 into your 15 days of recommendations.
Yes.
A lot of people are following them. Some people are not.
Yeah.
Do you think the American people are doing enough right now to slow this?
I think they are, and some people are not, but I think they are. I think it's going to have a very profound effect. We'll know a little bit more on day 14 and 15, and we'll see.
Once we get to
we're going to see. We have to see what the result is. We want to flatten that out, and we're going to see what the result is. And I just want to say, I'm going to negotiate a very large transaction, and I've been negotiating it for 2 days, So I'm going to take one or two more questions, and then I'm going to leave it to Vice President Pence on the Hill, with the Hill, the various elements of the package. Steve, go ahead.
There's a number of groups are calling for the postponement or cancellation of the Olympics. Have you given him third?
No, I haven't. Look, we understand the difficulty of that, and he's a very good friend of mine. You take a look at Shinzo Abe. He's a great gentleman. He loves his country. We have an incredible relation. We just finished a trade deal with him, $40 billion trade deal with Japan. And Prime Minister Abe has a big decision to make. You know, they have built one of the most beautiful venues I've ever seen. They're all ready to go. It's not late. It's not over budget. It was just done flawlessly, and it's beautiful. And they're sitting back and saying, you know, I told him, I said, that's your decision, and it is his decision. And I know he's going to make it soon. I don't know what it's going to be, and I didn't think I should be influencing it at all. I mean, the job that Japan has done on that venue is incredible. So, I mean, there are options, obviously, including delay and maybe delay for next year, but that's totally up to them. We'll see what they do.
Since this story keeps popping up, when did you first learn that this was going to be a problem?
Well, you know, when I learned, I started doing the closing. So, you know, probably around that time. We didn't learn much. I think you're going to ask a little bit about China responsibility. I do think that, again, I have great respect for China. I like China. I think the people of China are incredible. I have a tremendous relationship with President Xi. I wish they could have told us earlier about what was going on inside. We didn't know about it until it started coming out publicly. But I wish they could have told us earlier about, because we could have come up with a solution. Tony Fauci and all of the people, the talent that we have, would have loved to have had 3 or 4 months of additional time if you knew that this was going to be happening. They didn't have that time. They read about it in newspapers like everybody else. China was very secretive, okay? Very, very secretive. And that's unfortunate. With that, I have great respect for that country. I have great respect for the leader of that country and like him. He's a friend of mine. But I wish they were able to, I wish they would have told us earlier, Steve, that they were having a problem, because they were having a big problem and they knew it. And I wish they could have given us an advance warning, because we could have had a lot of things. As an example, some of the things that we're talking about where we order them as quickly as we can. If we had a 2 or 3 month difference in time, it would have been much better. Yeah, please.
Can I follow up on that?
Yeah.
Because as you were saying, China was extremely secretive about this. Several of your advisors have been warning, have been critical of China. Secretary Pompeo was talking about it yesterday, and he had been saying so for quite some time. So why then, on January 24th, did you tweet that China has been working very hard to contain the coronavirus, that the United States greatly appreciates their efforts and transparency?
Because
it
it's
will
true.
all work out well.
Because
Why were
it's
you
true.
saying that, though?
China has worked very hard. China has lost thousands and thousands of people.
Right?
No, they weren't transparent. They were transparent at that time. But when we saw what happened, they could have been transparent much earlier than they were.
A month after China.
But China, just so you understand, China is not a beneficiary here. China has lost thousands and thousands of people. China has gone through hell over this. They've gone through hell, and I've had conversations with President Xi. I just wish they could have told us earlier. They knew they had a problem earlier. I wish they could have said that.
Are you able to share, thank you for the numbers on the testing, by the way. Are you able to share any other hard numbers on number of available tests, on number of ventilators in the federal stockpile?
Well, I'm going to leave that up to Dr. Fauci and everybody else, and I think the answer is we want to share them. I would imagine we want to share the numbers as, Admiral, do you want to discuss that?
500 billion masks that you cited, they're due for delivery in 18 months.
Not billion, no, not billion.
500 million masks, excuse me, thank you.
I said, wait a minute.
Half a billion masks, they're due for delivery according to HHS within 18 months. The last number on ventilators we had was 12 to 13,000. Can you give us an updated number?
Well, there's never been numbers like this. You know, a ventilator is a machine. It's a very complex machine. And to think that we have to order hundreds of thousands, nobody's ever heard of a thing like this. You know, when we had in the stockpile, we had thousands in a stockpile, thousands ready to go. That's a lot. All of a sudden, you need hundreds of thousands. And you're not talking about, you know, the mask is whether it's plastic or whether it's material. That's one thing. But you're talking about a very sophisticated, heavily computerized machine, and delicate. and you need hundreds of thousands of them. Nobody's ever heard of a thing like that. With that being said, General Motors, Ford, so many companies, I had 3 calls yesterday directly. Without having to institute, like you will do this, these companies are making them right now. But to think of these numbers, it's pretty mind-boggling.
Do you have numbers to share though right now? Do you have numbers to share with us right now?
Mike, go ahead, please.
Yeah, you bet. Well, we've spoken a lot about masks this morning, but the president's also given the task force a priority of assessing the availability and expanding the availability of ventilators. And on Monday, we will detail some very encouraging news for Americans. You speak about the number of 13,000. It is a little more than that we have in the national stockpile. But it's important to remember that that doesn't include the more than 100,000 ventilators that are in healthcare facilities and hospitals around America today. It doesn't include what will be produced, as the president said. We're seeing companies step forward. These manufacturers tell us that a ventilator actually isn't a very complicated piece of equipment, and many of them are literally surging forward to create more ventilators. But one of the more exciting developments in the last week, which we'll detail more on Monday, is that in the president's engagement with our healthcare community, we learned that ventilators that are currently used by anesthesiologists, that are used in outpatient clinics and in other procedures, can be converted to be used as ventilators for people struggling with the effects of the coronavirus. We've confirmed that a particular screen in that device can be changed readily. We're working with the FDA to approve that. But again, it's a great testament of the American people and our healthcare professionals that are stepping forward and bringing ideas forward that literally, as we'll document Monday, will increase the supply of ventilators by tens of thousands. But look, the president's made it clear. We want to make sure that all the incredible, courageous men and women who are serving in healthcare around America have the support they need, that our patients that are struggling with recovering from coronavirus have the equipment they need. And we'll have a lot of detail on Monday as we continue to assess.
8 days ago that we would have 1.4 million tests on board by the end of this week, by today. Do we have that? Can you give us the number that we have?
Let me let Admiral Goff speak to that.
Thank you.
So I'm going to answer your question and then try to persuade you to stop asking about a specific number, okay? So from March 2nd to March 14th, we have put over 10 million laboratory tests into the U.S. commercial market, and we expect that by March 28th to be well over 27 million into the market. So that answers your question, and let me tell you why it's not the right question. Not every lab can run every test. Not every test is completely self-contained. So the more important question is not how many tests are in the market. We got them in the market, but is to make sure that every segment of the market has the kind of test that they can use.
Admiral, we're using your numbers, trying to find out for the public if the things you've promised are happening.
Yes, they are happening. They are. We promised 1 or 4 million. There's 10 million tests in the market now.
And are the masks that are in the strategic reserve being deployed, Mr. Vice President?
Yes, the masks in the strategic national stockpile.
So it's not 13,000 anymore. It would be a lower number. Would that be fair to say?
Masks or
No, the ventilators. I'm sorry, the respirators. Thank you. We're trying to understand if the things we have been told sitting through these briefings for many days are happening and getting into the hands of the healthcare providers.
You understand it. You understand it. You're an intelligent woman, Kelly. You understand exactly what he's saying. And what he's saying is rather incredible because we inherited an obsolete, broken system. And when you hear the number of tests that we'll be providing and are now, it's incredible. And I've heard a lot of governors say the same thing. We took over an obsolete, broken testing system that wouldn't have worked for even a small problem, let alone one of the biggest pandemics in history. And what these gentlemen have done is incredible. I am going now to negotiate a great deal for our workers and our citizens. I'll be back tomorrow. We're probably doing this tomorrow. And if I might, I'd like to ask Vice President Pence to take over, and thank you all very much. Thank you.
Thank you, Mr. President.
Mr. Vice President. Mr. Vice President.
Thank you all.
Sorry, Vice President.
How about back here?
Mr. Vice President, the military has sent planes to Honduras, Morocco, and Peru to pick up Americans and bring them home who've been stranded there. But there's still a lot of other Americans who are stranded and can't get home. So does the military plan to send planes to pick those folks up? Where will those planes be going? When will they be going? And can you assure Americans that who are stranded in foreign countries that they will be able to get home?
Well, we received a briefing this morning from the State Department about their efforts. And we want to be very clear. While the President has suspended all travel from Europe, including the UK and Ireland, suspended all travel, of course, from China since January, that any American who can get home can come home. They'll go through additional screening that's all been implemented and is working in an orderly way at a number of airports around the country. But there are instances, Morocco being among them, where there simply are not flights to get home. Our State Department has been working very closely with our embassies in those relevant countries. I was told this morning that all the way going back to bringing Americans back from China, that we have made individual efforts to bring home about 3,000 Americans. I think there is an ongoing effort to address that with chartered commercial flights that the government is providing. Obviously, also military transport is available, but our task force received a briefing this morning, and we would just encourage any American that's looking on from overseas, contact the local U.S. Embassy, let them know about your circumstances, and know that we're going to continue to work very diligently to get our Americans home.
All right, guys, last question.
Two quick ones, education and a medication one. You guys have announced that standardized testing is essentially canceled in this country. To the tens of millions of students out there, their teachers and their parents who are sort of scratching their head wondering, well, what does that mean? Obviously, a lot of this is driven by local school districts, by the state. Is there any federal guidance on this? And if not today, could you have Secretary DeVos or somebody come and explain that to the millions who are literally sitting at home trying to figure out what exactly that means?
Well, I think it's a terrific question. And we will bring Secretary Betsy DeVos here tomorrow or on Monday to address our efforts. The objective here was as people are embracing the President's 15 days to slow the spread, we have decisions by local school boards and local and state officials that have canceled school or suspended school for a time. And we wanted the Federal Department of Education to make it clear that the burden of standardizing testing, which back in my days as governor, I remember takes a number of days and sometimes up to a week to administer, is not going to be placed on schools. But we'll have the Secretary here to address that very specifically, and it's a very good point on your part.
I mentioned I had a medication question, and I wanted to ask it while the President was here, because earlier he tweeted that there were two certain medications that when taken together, quote, have a real chance to be one of the biggest game changers in the history of medicine, and that they should be, quote, put in use immediately. Since he's not here, I can't ask him what he meant, but I'm wondering if Dr. Fauci or the Admiral could clarify if you have any sense of what he was talking about and whether his 74.5 million Twitter followers should be taking medical advice from him or from someone else.
The President brought together the top pharmaceutical companies in America and in the world a number of weeks ago. And they formed a consortium to work on a range of responses, beginning with therapeutics, which for a layman like me, that just means medicine to make you feel better. They're already going to work on that. We actually think, Dr. Fauci, I think there's some sense that our great pharmaceutical companies may actually be producing therapeutics that will give relief to Americans struggling with coronavirus as soon as this spring. We also challenge them to work together as rapidly as possible to develop a vaccine going forward. And as Dr. Fauci has indicated, We brought a vaccine to clinical trials now the better part of a week ago, the fastest time in history. Now, it's the first phase of the trials, and people should understand, as our health experts have described, that there'll be a period of as much as a year and a half before we can make those vaccines available. But as the President said at this podium, there is some anecdotal evidence that several existing medicines may have brought relief to patients struggling in China and in Europe. And the President has tasked the FDA to work very rapidly to allow what's called off-label use for those. One is a malaria medicine. But this morning, I think the President reiterated the hopefulness that he feels about this, that because these are medications that are time-honored and tested, they've been taken for many, many years, that we want to pursue, number one, making those available if someone's doctor believes that it's appropriate. The doctor would be able to prescribe that medicine even though that's not indicated. That's called an off-label use. But the other piece is, as Dr. Fauci said, and I'll yield to him, in deploying those medicines, we're working specifically with one state to do so in a way that represents a clinical trial. So it would not just be compassionate use, which the medicines are already being used for in some jurisdictions today, but also we could study it and determine the viability of it. And in fact, we're working diligently right now with that supply chain to make sure that those medicines are available. Dr. Fauci, did you want to speak to that?
Sure. You know, it's essentially what I said multiple times from this podium, is that when you have, first of all, we're trying to develop de novo drugs that are not yet out there, not approved, that ultimately would be effective. And the way you prove that is to do a randomized controlled trial to prove safety and efficacy. I'm not totally sure what the President was referring to, but I believe he's referring to a report that used both hydroxychloroquine and azithromycin together to have some possibility of being in effect. Many of the things that you hear out there are what I had called anecdotal reports. They may be true, but they're anecdotal. So the only thing that I was saying is that if you really want to definitively know if something works, that you've got to do the kind of trial that you get the good information. The President is talking about hope for people, and it's not an unreasonable thing to hope for people. So when you have approved drugs that physicians have the option in a decision between the physician and the patient, are you going to use a drug that someone says from an anecdotal standpoint, not completely proven, but might have some effect? There are those who lean to the point of giving hope and saying, give that person the option of having access to that drug. And then you have the other group, which is my job as a scientist, to say my job is to ultimately prove, without a doubt, that a drug is not only safe, but that it actually works. Those two things are really not incompatible when you think about that, particularly when you're in an arena where you don't have anything that's proven. We went through the same sort of thing with a little bit of a different twist during the HIV/AIDS epidemic until we finally developed drugs that were absolutely knockout drugs that were safe and that were effective. But in the beginning, there was that tension about that. So you really got to have a balance. I've got to do my job as a scientist, and others have other things to do.
Great.
Mr. Vice President, question for Dr. Carson? Yeah, question for Dr.
Let me just, if I may, let me just say, I hope this morning has been informative. We will be back again tomorrow. And I hope the American people are encouraged because of the incredible whole-of-government approach, because of our collaboration with states. You're seeing testing expanded all across the country. That incredible public-private partnership with commercial labs is now making testing available by the tens of thousands. We're working very diligently with an incredible response from American industry to make sure that personal protective equipment, and ventilators, and all the things that our healthcare providers need to meet this moment is there. But let me just say again what every American can do today. And that is, first and foremost, heed your state and local authorities. There are individual states, California, Washington State, and at this moment, especially New York, that have issued guidance to their citizens. And as the president said, we wholly support the leadership that those governors are providing in their states. But secondly, every single American can put into practice the principles of our 15 days to slow the spread. The president's coronavirus guidelines, as I said, we're 6 days in, and the purpose of these is not because every American is at risk of serious illness. As we said before, all our experts tell us, all the data shows, that the risk of serious illness to the average American remains low. But because the coronavirus is, we think, 3 times more contagious than the flu, to slow the spread, to literally lower that curve and spare Americans around our country with being exposed to or contracting the coronavirus, or worse, every single one of us can put these principles into practice. I recommend that you go to coronavirus.gov, sit your family down, call a neighbor and a friend, support efforts in your local community to put these principles into practice. And as people all across this country continue to do just that, I just know we'll get through this, and we'll get through this together. Thank you all.
Will there be a briefing of our citizens?
We'll be back here. Thank you, Mr. President.
Thank you, sir. Thank you, sir. Thank you, sir. Thank you.
Thank you, sir.
And that is the Saturday edition of the White House Coronavirus Task Force.
Small business, when you add them up together, are really the economic engine of our country. And I assured them that my administration is doing everything within its very considerable power, frankly, to support them and their employees. Nobody's ever done what we've done. Likewise, I had calls during the week with all sorts of representatives and systems like the hospital system. We spoke to many of the hospital systems throughout the country, nurses and doctors, representatives representing hundreds of thousands of nurses and doctors, airlines and cruise ship companies, the Business Roundtable, which was fully attended, and it's all of the top CEOs of our country and beyond, frankly, the businessmen of, really, these are world-styled businessmen. These are businessmen that control the biggest companies in the world. Many of them have taken hits, and many of them are just, going forward. Their businesses have been great. Some have been very badly affected. Some haven't been affected at all, and frankly, some are doing very well. They continue to do very well. It's Walmart, as an example, has been really helpful to us. Doug McMillan, head of Walmart, really helpful to us, and I guess I assume they're doing pretty well because people are certainly buying more than even a clip at Christmas by substantial numbers. Pretty amazing, but they're doing incredibly. They put on tremendous extra staff. You don't have empty shelves. A lot of things have happened that are very good. Restaurants, fast food executives, grocery stores, all retailers, literally all of them, in groups. And we spoke with the G7 leaders at length, as you know. You probably know about that. Spoke to many of the governors, spoke to almost all of the governors at conference calls, and many of the governors individually. And very importantly, the religious leaders. We had a great conversation yesterday, the Vice President and myself, with the religious leaders of our country, many of the religious leaders, and we've had a number of them during the course of the last 2 weeks, actually. But yesterday we had a very significant call with the religious leaders of our country. I signed legislation providing American workers with paid sick leave and paid family medical leave at no cost to employers, and free testing for those who need it. The testing's going very well, and the Admiral will speak to that along with Tony. We're working quickly to pass additional legislation that will provide massive relief to small businesses and affected industries and give direct payments to our great workers and hardworking American families. There's never been anything like we're doing on the Hill right now. They're negotiating. Mitch McConnell, Chuck Schumer, they're all up there. Kevin McCarthy and Nancy Pelosi. They're all negotiating, and everybody's working hard, and they want to get to a solution that's the right solution. I think we're getting very close. We've also announced that we've moved tax day from April 15th to July 15th, which is a big deal, giving businesses and individuals extra time to file and pay without interest or penalties. So we've moved the date way back, and so it'll be July 15th instead of your traditional April 15th. And very importantly, you will have a lot of time, but you're not going to have interest penalties or any kind of penalties by filing at that later date. HUD announced that foreclosures and evictions are suspended for single-family homeowners with FHA-insured mortgages for the next 60 days. And our great head of HUD, who's with us today, Ben Carson's going to say a few words in a moment. The Department of Education will not enforce standardized testing, which is another big deal, requirements for students in elementary through high school for the current school year. Not fair to do that. So we are waiving that. I would imagine it's probably the first time ever that's been waived, but I think it's only fair to the students and to the parents of the students. It is also waiving interest and other things that we're discussing right now on federally held student loans, and directed that borrowers be allowed to suspend their student loan payments without penalty for at least 60 days. And we'll be talking about student loans, going to help the students. They're under a great burden right now, so we will be talking about that further, but we're waiving during the 60-day period various elements and very important elements on student loans, big subject. I signed an executive order invoking the Defense Production Act, as you all know, giving us powerful new authorities to help states, cities, and hospitals procure needed supplies. There's been a clear call to action to the private sector, and the call is made right here. It's been really pretty amazing what's happened with the private sector. They are really in sixth gear, I think, which has responded in full force, helping to produce and supply much-needed masks, swabs, sanitizers, ventilators, and everything else. There's a move on that's incredible right now. And by way of example, Hanes, everybody knows Hanes, great company, great consumer cotton products company, is retrofitting its manufacturing capabilities in large sections of their plants to produce masks. And they're in that process right now.